All right, we're going to go ahead and get started. Welcome to day 4, and McSweeney and Atkinson team here up again. Thank you. You guys are listening to everything that's going on at the county. You'll be ready to serve at any time. Yeah, appreciate your service and being here this morning.
Not on the sheriff's budget.
There may be somebody up.
Okay, he gets no input on the sheriff's budget.
Right here. All right, let's get started. Health Department. Dr. Cho here.
So good morning, Mr. Chair. Chris Rose, Office of Management and Budget. Dr. Cho is out today, so he will not be presenting. We have Melissa Van Bruggen, Assistant
Melissa,
Director.
welcome.
And a couple of other folks from the Health Department in the audience, all supporting the effort. So Tony Merrill is going to be presenting from my office first, and then it will go over to the Health Department. So Tony, the floor is yours.
Good morning, Commissioners.
Good morning.
We're going to go ahead and just jump right in and start at page 1 of your document with the department purpose. Following the department purpose, we're going to look at the budget drivers. In fiscal year 27, the Health Department fund budget, excluding transfers, is increasing by $258,000 to $8.9 million, reflecting a modest growth in operations. That growth was based several weeks ago on a 2% assumption, so it will be reviewed as we do every year once we get the completed and the property tax, the official property taxes. The fund revenues are increasing primarily due to the higher ad valorem tax revenues, along with gains in interest earnings and excess fees by the tax collector. The ad valorem revenues are increasing by $177,000 to $9.7 million, while interest is increasing to $280,000, and tax collector excess fees are increasing to $66,000. The fiscal 27 expenditures, excluding transfers, are increasing by $256,000 to $8.2 million, largely due to the higher grants and aids. Within core services, we have cost decreases due to the completion of a $500,000 roof repair project, while new investments include $156,000 for the St. Pete assessment and also a $600,000 mid-county moisture mitigation, which the department will be able to explain more about that to you. Total transfers from the Health Department fund increase by $2.6 million to $7.2 million, bringing the total budget, including transfers, to $15.9 million. The increased transfers are intended to reserve funding for future capital infrastructure needs, particularly ongoing improvements to the St. Petersburg Health Department facility. On page 2, you'll see a little bit about the user fee request. The Health Department is asking to expand the use of their comprehensive emergency management plan review fee, and also to add in a new biomedical waste licensing processing fee. These fees are a function directly with the Health Department, and the county has no control over these fees. At this time, I'm going to go ahead and turn it over to Melissa, who has a video or a PowerPoint presentation, and she's also going to speak a little bit about the department context and considerations and the fiscal 26 accomplishments. Melissa?
Good morning, everyone. As Tony said, I'm Melissa Van Bruggen. I'm the Assistant County Health Department Director in Pinellas. So I'm going to start with just telling you a little bit about our mission, which is coming up here on this slide next. So it is to protect, promote, and improve the health of all residents and visitors in Pinellas County, their integrated state, county, and community efforts. So the need for our integrated state and county partnership to meet public health needs is defined in Florida Statute, Chapter 154, which you can see up there. So We do this through our core contract from Pinellas County to deliver public health services. So this is the funding we're talking about today, our core contract funding. Also, just wanted to touch on our top health priorities. So in our most recent community health assessment and improvement plan, our community partners and residents identified these 3 areas up there as our top priorities, health priorities in Pinellas. So mental health and substance use, access to care and social services, and health promotion and behaviors. Okay, and as Tony mentioned, I'm going to talk a little bit about a couple things under context and considerations related to our upcoming budget. So a couple things, they're both related to capital projects, which were referenced. So the first one is with our St. Petersburg site. I think last year we talked a little bit about the need for looking at a new location for St. Petersburg, a very aging building. We're in a 1930s building, and we're sort of being surrounded by condos and having a little bit harder time reaching our population who's moving to different parts of the county. So we've been looking at St. Petersburg. This year, CBRE came in and did a assessment looking at the conditions of our current facility, looking at future space needs and requirements, what a new facility would cost, kind of a complete financial analysis. So they did find or made a recommendation for a new facility. And with that, they determined that, or made an estimate that we could get, at our current property is worth $22 to $24 million, but we would need an additional $69 to $100 million for a new site in St. Petersburg. So that's why you'll see some additional funding in the capital projects fund to work toward a new St. Petersburg site, which is going to be a long-term plan. Second item up there is related to our Mid-County site, the Mid-County Health Department. There has been moisture intrusion confirmed coming through the ground. So we did have some engineers out who confirmed this and recommended we install a moisture barrier, which is going to necessitate sort of taking out the whole first floor and replacing that flooring. So the estimate on that right now is $600,000. We are filing an insurance claim though, so we hope to not use that $600,000 toward this, but potentially put that into that capital fund toward St. Petersburg as well. But those are kind of the 2 major items for the upcoming year. All right, so moving into the better stuff, I'll talk about some of our accomplishments this year. So our locations provided about 1.1 million services to about 120,000 residents this past year. A couple of those are highlighted here. We did over 20,000 sanitary and safety inspections. We performed the highest number of STI services amongst all local health departments in the state of Florida. Our maternal child health home visiting program saw about 2,600 families, and our WIC breastfeeding team received the USDA's WIC Breastfeeding Gold Award of Excellence. A couple more specifics. We are continuing our work on opioid overdose prevention. We continue to facilitate the Pinellas County Opioid Task Force. We distributed almost 2,000 naloxone kits throughout Pinellas County. Dr. Cho is participating in the Opioid Abatement Funding Advisory Board and continuing to support the idea exchange. And through these efforts and others in the community, we are continuing to see a decline in opioid overdose deaths. I'm next going to talk a little bit about school health nursing. So we are continuing to contribute about 40 LPN positions to Pinellas County schools. These LPNs do also help ensure that we have adequate nursing staffing to operate our special needs shelters. And on this slide too, you can see some of the accomplishments of these nurses this past year. A big part of what they do is referrals for mental health and social services. So from the year prior to this past year, we saw an increase in those referrals of about 300 to 6,154 referrals this school year. They've also made great efforts to improve our physical screening rates. You can see up there, vision, hearing, BMI, and scoliosis screening rates are all above 95% for the county. They've also worked to improve our return to class rate. So at our schools with these nurses, we've increased from 88 to 90% return to class rate this school year. Next, our dental sealant program. So these are teams of hygienists visited 53 Title I elementary schools this school year. They served about 6,800 students through their work, doing screenings and oral hygiene instructions. They performed 5,600 cleanings, applied a total of 8,500 sealants to 2,637 children. Not up here, but they also visited 14 Head Start locations and provided services to another 700 children in Pinellas. Talk a little bit about our funding now. So this slide here is just an overall look at our resources for the health department. So our entire budget is about $65 million. So this just kind of shows where your contributions are going. So most of our budget, about 65%, is coming from the state and other local grants and contracts. And then this core contract is that light kind of teal blue shade there. About 12% of our entire budget is coming from this $8 million. I'll move to the next one so you can see a little bit more on that. So this is the $8 million in our core contract, so you can see what that funds. The vast majority of that, about 51%, is going toward our clinical services. So these are those core public health clinical services. 25% is going to the school health nursing that we talked about. 8% to the dental sealant efforts, about 8% to our environmental public health services. And then you can see the smaller slices there, things like building improvements, admin, infrastructure, performance improvement efforts. All right, and then this is just kind of another look at those resources there. So of our $8 million, you can see our ad valorem tax rate. And of the $8 million, about $6,000 is going again to those core public health services, and then about $2 million to the school health nursing efforts. And then you can see the capital project amount there as well at just over $7 million. That was my last slide, and can take any questions.
Yes, Commissioner Flowers, please.
Not a question, but just a comment. I've spoken with Barry about this some time ago, and I also met with Dr. Cho about a new facility in St. Pete, because that building is, you all are really cramped, and it's very small. And I know that, and again, nothing in stone, it was just a conversation. The mayor did have a conversation with Dr. Cho about whether or not the city of St. Pete would be interested in purchasing that space. And then there was some potential for other locations. So just wanted to put that out there. I couldn't tell my other colleagues when I was having that conversation, but I was appreciative of at least the thought about it, because you all do a wonderful job down there. And I know it gets a little, especially around the first of school for inoculations and stuff like that, it gets extremely, you might, huh?
No.
Oh, it gets extremely crowded down there for parking. You know, your parking space is over here. You're right on 9th Street. But the good part is it's a bus line. And so persons who don't have vehicles can, you know, get there quickly. So I like that. But I've been down there in the dental part, in the back side, in the WIC side. And I really appreciate all the work that staff is doing down there in the confined space. Thank you. I'm sorry. Did you post this?
No, I thought the chairman had a
No, I
question
just
for
say
me.
who the facility belongs to, I was asking.
Yeah, okay, so there are facilities, so we provide that. Different from other funds, since the health department has a separate fund, okay, it's a separate levy, they do carry a reserve balance, and but they also take care of their own capital. And that's the reason they run a reserve capital fund in order to go towards future capital. We've never really pulled together the financials of what a new building looks like, where it would be, and all those different pieces. We're just now, through the CBRE analysis, coming in to be able to have that type of conversation. And so there'll be more to come on that. It may be, I was just texting staff while we were talking, you know, it really may be a penny issue for the next penny, you know, and coming off the top before they do their distribution, since they provide countywide services. So, you know, those are things we got to look at. They definitely need a new building, and it probably, and the services need to be closer to the people they serve. But we're just now getting into the analysis of that. But that's the reason you see that $7.3 million reserve level that you don't see in other funds. We typically sweep those up because they're property tax based. Here you have a separate fund, so we're able to do that.
Yes, Commissioner Nowicki.
Thank you, Chair. Thank you for the presentation. Have we looked at like increasing some of these fees at all, like tattoo, piercing? I mean, you know, I have a real estate license and I have to pay like over $2,000 a year with association dues and all this other stuff. And for someone to have a permit for like $50 a year, I mean, seems a little cheap to operate a business.
Yeah, it is something we look at, and we do try to stay in line with the region and the state and what other Department of Health locations are charging as well, but it is something we look at, and that, I think the fees were mentioned, so we did add biomedical waste, additional fees there, for example, because we've seen over 100% increase in the number of facilities needing those inspections, so it is something we look at and try to make sure that our fees are comparable to other similar locations across the state and region.
Yeah, I mean, I just think it would cost more than like $50 if there's a complaint or something for the resources we have to use to like process it. I mean, is it like paying for itself barely? I mean,
Yeah, and that's really what we try to do is make sure that based on the number of facilities and inspections we do, that it's covering the cost of providing those services.
Yeah. And then but taxpayer dollars go towards that as well, or no?
For some of them, yes.
Yeah, I mean, so I would be in favor of like increasing the fees
We can take a look at that, yeah.
so we don't have to use taxpayer money to offset that. I would be in favor of it, but thank you.
So just, again, for clarity, this ad valorem tax thing we're talking about, that makes up the 8 million, most of it, but where does, it says capital project number's been building? Is that what we're saying, over?
So they carry a reserve level that goes towards capital because it's a separate fund.
Right.
So it's not swept up at the end of the year.
Understand.
So it's a carryover.
Okay.
Then, and that, it increases. That's the reason you see at the levy amount, it increases that reserve because then that reserve goes towards future capital. And they've always had, looking at what would a future building look like, and up until this point, we really didn't know what that meant.
And your comment or thought on the nursing program that's in the schools, doing well? I mean, I saw the numbers and such. It's all relative to me, so if you could.
Yes, and we do look at those, kind of the rates there versus other schools that aren't supported by the same level of nursing, and definitely those rates are higher. And we do like to highlight those referral numbers because we are in schools that have more of an at-risk student body, so we do try to that's why one of the reasons we're in those particular schools and really focus on screenings and connecting them to needed services and making those referrals.
Do we know the percentage of our schools that have nurses now? Do we have a sense of that?
So these 40 are in our Title I schools, but I'd have to look into the total number of schools with nursing. So we don't have a nurse in every school every day, but every school has a nurse at least some days of the week.
Okay. And what portion of that do you feel is going towards the mental health side?
Sorry, can you say that
The
again?
number of interactions in the schools going towards mental health issues that are arising in schools. Is that on the uptick, kind of steady?
Yeah, I think so, and I think I highlighted go back to that slide quick. Yeah, you can see the number of those, so you can see it increased from about 5,800 to 6,100 referrals.
That was just the mental health?
That was for mental health and social services, but I would say a large portion of that is mental health, so we're definitely seeing an increase in that need.
Okay. Anybody have any other questions?
I had a couple.
Yes, Commissioner Scheer.
On the school health, so the county contribution covers the school health nursing, not
Again, this is a separate fund, a health department fund, separate portion on your property tax. So we increased that many years ago to cover the school nurses. So it comes out of that fund.
okay. Are our contributions to the health fund prescribed by law, or is it discretionary?
Well, we sent you a little thing from FAC day before yesterday. The answer is a base level, yes, not necessarily all the services that are provided.
How about school nursing?
School nurses are not required.
I brought it up because, school districts aren't impacted by the changes to the tax law. Is that right?
I know.
So
Yeah.
what does that program cost, the nursing program?
Just school nursing.
Okay.
So, this is another example of those things that, should things change come November that we'll have to look at, you know? And because we lose $2.5 million out of the Health Department fund should that pass. And so, again, we'll wait and see what the outcome of the voters say and make a decision at that time. But that would likely be something we would have to discuss.
Thank you for asking that question, and just a little history on that, because I served on the school board when the request was being made. There were a number of medical concerns with children within the Pinellas County school system, and not having someone there at the school that could help administer medications if the child was on medicine, because teachers couldn't do it. It was, you know, they can't give them whatever the medicine was. And so there was a request that the Pinellas County Commission support and contribute towards, the original ask was a nurse in every school. That's kind of what the name of the program was. And then the county commission, bless their heart, we appreciated it at the time, made the decision to help us with the funding of nurses as was shared. So some schools have a nurse for half a day, so that nurse will be there half a day and then they go rotate to another school. It's about 27 Title I schools, so some of the nurses were in some of those schools more of the time because of some referrals for counseling and mental health services and things like that for the children, especially if the child was on Ritalin or anything of that nature. And so, as Barry said, you know, that was something that we asked. It wasn't something that we had the money for at the time in the school district budget, and I'm not sure how they'll work that out, you know, going forward. But I just wanted to give you that little bit of history about how it came up, and it has proven to be very good. But again, as has been said, it's one of the things we may have to look at, saying to the school district, they may need to see how they can cover it if it comes down to it. So I just wanted to share the background on that.
And the 88%, 90% contract return to class rates, kind of middle of the road, good, poor? I mean, I have, again, nothing to compare to.
Yeah, I don't have the exact number of the others. I can certainly get that, but I know that it is higher than the average school for sure. Yeah, 90% is a very good return to class rate.
Yeah, I think the discussion then between the school board and the commission was more about, yeah, we all agreed that it was needed to some degree, but at the time, they needed the help to make it happen. And I think that was why there was a small millage increase in that fee. But things, you know, the days are different today, so how it gets paid may be, you know, may be different. So, okay, anything else? Oh, you had something else I need. Nope. Yeah.
And the school district partnered with a entity called Preserve Vision, and they go out to the Title I schools. They also provide the vision screenings on site and will do the prescriptions for the glasses for the children. And then the family just needs to go get the glasses. So that's a way that we were able to partner. They were able to partner and assist so that kids who may have missed their vision screening and whatnot, or were having difficulty, and families maybe couldn't afford the glasses. So there are some other partners in the community who have been trying to step up to help provide some of those services.
Okay, that's all right. It's okay. No, appreciate your insight. All right, thank you. Appreciate it.
Thank you.
Yep.
Thank you.
Dr. Thogmartin here?
Yep, Dr. Thugmartin's here.
Behind the post. All right, come on up, doctor.
So, Mr. Chair, as Dr. Thogmartin and Rita come up, Tony Merrill is going to be presenting again. In fact, she'll be sitting next to me for a while this morning. So Tony's going to start, and then we'll hand the mic over. So, Tony, the floor is yours.
Good morning. Again, we'll start on page 1 with the department purpose. And then we'll move on to the budget drivers. The fiscal year 27 medical examiner budget increases by $311,000 to $9.8 million, with the program continuing to be fully funded, 100% funded by the general fund. Staffing remains stable at 3 full-time employees, with a position reclassification this year from a DNA analyst to a DNA analyst lead, CODIS administrator. Under personnel services, the personnel services decreased by $11,000 and to approximately $422,000, despite maintaining current staffing levels. So they've been able to maintain those levels and reduce their personnel services. This decrease reflects personal adjustments and a position reclassification rather than the reductions to the workforce. Operating expenses are increasing by $315,000 to $9.3 million, representing the largest driver of the overall budget increase. The increase is primarily attributed to a $383,000 increase to the medical examiner's contract, driven by higher personnel and supplier costs. We'll now talk a little bit about the medical examiner's contract. The contract increases to $9.2 million, reflecting rising costs associated with providing forensic and medical examiner services. Some of the contract-related cost growth is offset by delaying the BTS-PC replacements from fiscal year 27 to fiscal year 28. The medical examiner has 18 fees charged to non-Pinellas County jurisdictions, and he's proposing an increase to those 18. Higher fee revenues will help to offset the professional service contract from the medical examiner and take a little bit of the financial burden off of the Pinellas County taxpayers. The CIP portion topics, governmental capital improvement projects associated with the medical examiner will be discussed later this afternoon. Future capital needs and project planning will be addressed through the county's broader CIP review process. And with that, I'm going to turn it over to Dr. Thogmartin.
Thanks, Rita. So during Tony's presentation, I was sitting here looking at the remote thinking if I click forward, I'd get ahead of you, right? I guess it's different. Anyway, yes. So we're at year 26, I suppose now. It's amazing, our synthetic opioid thing that we were dealing with, particularly 2020, 2021, 2022. Really, it kind of peaked in 2022, 2023, and it's kind of gone away. Multifactorial, but quite amazing. And again, we're thankful. I hope we don't go through that again. So our autopsy load ends up being about stable. Instead of going up like it was just boom, boom, boom going up. Now it's gone, it went down since 2023, but it looks like 2025, 2026 is gonna be right on par. So we've reached a new a stability here. I'm just waiting for some other brain candy to come out to be sold at your local gas station. Hopefully that doesn't happen. You know, so ME, from an ME standpoint, basically we're talking about baseline maintenance. No big surges or anything. Forensic laboratory still, you know, highly effective. I'll let Rita talk about that, you know, if you want. But they got some award again, that Foresight Award again. They also have a real fast turnaround time. If we had a case that involved Hillsborough County recently, and they just did, some of the workers that we have, you know, the turnaround time on getting those people identified, then that recent big case was fantastic. It was probably spoiled them a little bit, I guess. Because most of the time, you know, Hillsborough really doesn't interact with our lab, you know, on a regular basis. It just so happens that they were working a case that happened to be found in our county. So we worked it, we did the identification. Rita's laboratory did fantastic work. And then we're just continuing to experiment with different, you know, cost strategies, just trying to sharpen the sword constantly. So just so you get an idea, I do this almost every year, and I think it's really effective. The green is our office, our circuit,
That's, and it's fiscal year '27, so it's what we're asking for. So this is dollars per case, and just to put us at a disadvantage, you know, a little handicap, right? I put next year's request, 300,000+ higher, versus all the other offices, their current budget. If I put our budget in, our current budget in here on par, we'd be even lower. We're just less expensive. If you do it on a per autopsy basis, again, just across the board, crazy less expensive. And, you know, you ask me, you know, you may ask me, you know, what is that? Well, it's become kind of funny when offices collapse, like if there's an ME office that collapses or a lab that collapses, they tend to reach out and ask, hey, can you help us? And basically I'll be real simple. Anybody in finance, if you have a column that's twice as tall as my column and you ask me for help, it's easy because I exploit the difference between that green column and the top of that blue column, and it makes it real easy to do. And some of those offices, if you look, St. Augustine, Tallahassee, Gainesville, Daytona, the little lower ones, you know, I can't talk about what happened since we left, but those are offices that we blunted. Even Jacksonville, I mean, we've, you know, basically it's kind of like giving them the courage to stop doing dumb, wasteful stuff, and it just carries forward after we're gone. Violent death too, or, you know, if you do it per violent death, you know, our cost per violent, actual non-natural death is lower as well. Now, do you want me to talk about your stuff, or you want to talk about your stuff?
Okay. So the forensic lab continues to operate very efficiently. Our cases, we had a little bit of a decrease last year, but the decrease was strictly in postmortem toxicology. As Dr. Thogmartin said, the fentanyl crisis tends to be ebbing. There are new drugs on the horizon. They've kind of hit as low as Kentucky, but they haven't hit here yet. Let's hope they don't, because I think we'll see another spike if they do, because that's what they're seeing up north. But because of that, we end up with a 7% decrease in postmortem toxicology cases. We did eliminate a senior toxicology position through attrition that we didn't replace based on that. But in all of our other disciplines, we're still seeing about the same amount of work, DNA, seized drugs, and DUI toxicology. That's about all I can say about it. So there's an award called the Foresight Award. Foresight Award, sorry, he didn't tell me. I was talking until 2 seconds ago. The Foresight Award is presented by the American Society of Crime Laboratory Directors, and it is given to laboratories that perform at a business and management efficiency. So the biggest two factors they look at is the cost per case and the number of cases per analyst. And for every laboratory that operates within at least 90% of what they determine to be those milestones gets this award called the Foresight Award. And we've got that award for 5 years straight. And we actually, for most of our services, are over 100% on their efficiency base. So we are very efficient in terms of the cost that we have per test, and also the number of tests, the productivity of our analysts. And we actually are very proud of that work, because it really does demonstrate that we are as efficient as we can be with the funds that we receive.
Main thing is it's bookmarked, you know, amongst other labs, so they just run better. It's just all her, you know. And this kind of gives you an idea, you know, if you look at, you know, their turnaround time. They're always like, you know, if you talk about length of time, I mean, if you submit a sample, you want the results back, because it could actually save people's lives, you know, if you're talking about, you know, I don't know, DNA and stuff like that, making sure that bad guy gets snatched off the street, that's kind of important. They're always quicker than everybody else. Just turnaround time in general, even, you know, blood alcohol, whatever it might be. And then the salary and benefits, again, the amount of salary you're paying for that work is less than other places, but you're able to retain people. So it goes like it. I kind of like was explaining to some of my kids, you know, when you're looking for a job, you've got the workplace environment, and then you've got the salary. And if your workplace environment is poor, you've got to up the salary. But if the workplace environment is good, you can pay a little bit more competitive a less competitive salary and still retain the people. We retain people. She retains people forever. I retain people forever. The workplace, we just try to make it a good place to work.
Last year, we did do a salary adjustment, and based on these results, because we're still lower, obviously lower than the 25th percentile nationally, but we did a salary adjustment to make us more competitive with the other laboratories in the state. Part of that reason was because Hillsborough County was opening a laboratory. Manatee is getting ready to expand their laboratory, and we have this great reputation. I'm very proud of my staff and what they do. And we were targets to lose staff. And if you lose an analyst, a forensic analyst, if somebody leaves today, it's 2 years before they're effective once we get them. So we hire them, and then they're in training for 12 to 18 months before they're seeing casework. So, and you have somebody off the bench training them. So the board generously gave a salary funds for 2 years ago for salary adjustment. So even though we're in lower percentile still nationally, we actually are very close to the mean in the state. And one of the reasons this number seems a little bit lower, artificially lower, is because most of our employees are employees of Dr. Thogmartin. So they're not employees of the county, and therefore they're not in the FRS. And in the state of Florida, the FRS for forensic science is high risk. So you can imagine what the cost is for retirement if this was a county department. So that kind of the numbers that Foresight collects is salary and benefits. So while our salaries are actually much more comparable now, our benefits costs are still, I think we're running about 28% per person, as opposed to, I think it's close to 40% for like FDLE and so forth per person. So this number is just a little bit artificial.
Yeah, it's part of my blue column thing. Some of the offices that are ME offices, like if you don't talk about the labs, talk about the ME offices if they're county employees, and I don't know why they would do that. Your doctors are special risk. You're sending 32.79% of their gross annual salary to the state of Florida at physician pay rates. So the amount that they send is incredible. It's actually astounding. And anyway, so basically we're just trying to, look for cost efficiencies, grants. She's getting grants. Our ME side is getting some toxicology grants, and just trying to explore their income. Pasco County also gets a really good deal, but now that, there's inflation, I'm kind of hitting their fees every year just a little bit, just giving them a little increase. It's been, I think this is my 4th or 5th year in a row, giving them just a little tweak up in fees. I have to. And I show them the same column chart, and, you're getting a great deal now, so even with the increase.
Doctor? Yeah.
A great job. You always do a great job. I think you're amazing. And so, Rita, how many times have you won that award?
5 years.
5 years? She's modest.
Yeah.
Yeah, she is. She's modest. You guys just do an outstanding job. So I haven't gotten a count on the opiate deaths, and I know it's way low. Do you remember what they were last year and where we're on track for this year?
We were at about 470 last year. I'd say we're going to be pretty close to that this year. As he said earlier, we're leveling off.
So
Like we're at
about
our new baseline
470?
for deaths.
About 470?
470, yeah.
On opiate deaths? Okay. 'Cause
In the county, not in the district. Yeah.
In the county,
Cut in
yeah.
half. I mean,
Yeah.
basically almost
Yeah.
cut
Well,
in
we were,
half from
we
the
were
peak.
600 3 years in a row, about six,
Yeah.
well, 2 years in a row it was 600. Okay, that's still higher than I thought it was, but,
Yeah.
You still end up with, there's certain people that still get them from regular sources,
Right.
and they're still, and they're not we're just not seeing the fentanyl all over and over again as much as we used to.
Now, we still see it on the seized drug side. It's not that fentanyl has gone away. That's definitely not the case. But what is out on the street is much more diluted. So where it was at 90%, somebody injects 90% fentanyl, especially if it's their first time, they're going to die. So now what we're seeing on the streets more 10, 15%. So because of that, they're diluting the product. It's not quite as fatal. And also Narcan's available everywhere. That's saving a lot of lives.
Yeah, I was
So-
talking to a undercover narcotics guy, or a former undercover narcotics guy, and so what's going on? I was just saying, well, he said when he would do a buy as his, undercover persona, looking like a surfer or something, right? He said they would sell me fentanyl and then they'd give me a you got a Narcan? No, here's one. They'd give it to him.
The dealers would give them to him.
Makes logical sense, right?
It does. I
I
don't want
want
to
you
lose
to come
their
back
clients,
later. I don't want you to
right?
die. Here's a
Yeah,
Narcan.
yeah.
So
Don't wanna
I
lose
think
their clients.
it's supply is being squeezed, dilution of product, just less product in general, and then Narcan's everywhere. So you may have the abuse, but less death.
Okay. Thanks so much. Thanks for the good work.
Yes, Commissioner Flowers.
I'm glad you brought that up because as far as charging individuals, if they can locate the person who sold the drugs to the individual and they died, they charge them with their murder. So I guess that's why they started trying to provide the Narcan kits. I don't know. So
Yeah,
the-
I mean, I wouldn't want to be, I've been involved in numerous cases with that very scenario, and it's done two different, mostly I was kind of expecting bad stuff to happen, like they dispose of bodies, but no, it seems to really, it's setting an example, right? They're setting an example for a few drug dealers, and they want to avoid that.
So I do have a question. When you shared that it takes about 18 months or so to get a new forensic analyst up to speed, is that someone new to your office? So is it someone who, let's say they worked in Miami-Dade and they moved up here? So they have that experience, but they just need to learn maybe our way of work. Does that 18-month timeline apply to them as well? Or
No,
is
they
that for
tend to
someone
run
new?
about 9 months. We still have to do all the same competency testing and written exams and mock trials are still a process, but they have a lot of the core background, but they're expensive. So we tend to hire out of college. One, you don't have to break bad habits that way, and you actually start with a lower base salary that you're moving on from. We have hired some experienced people over the years, but we haven't found that overly successful.
And Commissioner Peters, you may know the answer to this, or maybe them. The funds that we received through the lawsuit for fentanyl, are any of those funds used to help prop up the department for testing and things like that?
Not
Since at one point,
currently.
we were way up high with
Yeah.
numbers.
No, the funds are not going
They
to
can't be
that.
used for that?
No.
Okay.
They could, but they currently are not.
Are not? Okay.
No.
And I was just thinking of, it wouldn't be a eternal fix, of course, but when you have, I hear we're leveling off at about 470, but if you have that influx, I was just thinking that may be a way to pay for any potential overtime or additional cases and things like that that could help the office, that could help the office on that. So thank you for sharing that, and thank you for your service on that.
I hope our goal will finally level off at like 150 instead of 400. It'd be better if it was like 0, but I mean, it wasn't that long ago. We were only losing 200 people a year, and then we just skyrocketed to 600. So, yeah.
And Doctor, I haven't been to visit your wonderful place, your home. But, we could make a deal here and say that we could give you what you're asking for if you change your mind about retirement.
It's going to be a long time. I'll be here longer than a lot of people actually are, Chief, so it's a long time.
Yeah, I know, I'm just throwing it in there. I just said that to make you laugh, that's all.
That's good.
Thank you, Mr. Chair.
Anybody else?
Sure. Thank you, Chair. Doctor, and I appreciate all the hard work. I don't know how you do all this with 3 employees. I can't figure it out, but,
No, they have probably.
Three's on the lab side.
okay.
Yeah.
Good. Well, I,
Wait,
you
yeah,
know,
you have
you all
what,
just
si-
run a
60?
tight ship over there, and I appreciate it. But I did want you to know that if you need to charge Pasco County more for your services, you don't need my permission.
We encourage him to do that.
I mean, I'm just trying to make sure they stay on par
Yeah.
with you. That's really what the goal is. That's the fair thing to do.
It helps us drive down our costs because obviously they're using our building and, he does a good
They
job of
don't have their
recovering
own
that cost.
forensics, and if,
do
without you,
not.
they'd have to go to the state, right? And that takes forever.
They, well, it's the circuit, so the District 6 is the same as Circuit 6, so Pasco's in there, same state attorney, same public defender, same medical examiner, but they, back in '03, when you guys built the building, they had a 20-year agreement. I was kind of thinking, well, at 20 years, they will, 5 years in, let's say 15 years in, they'd start planning and doing their own. But once you do the math on your own building, it gets to where their costs are going to go crazy. So what they're doing is, I actually had a discussion with them about it recently. The costs are just brutal, and they're getting, part of the problem is them not having their own building is giving them good turnaround time, good service. You got a lot more remote work. The detectives don't necessarily have to drive down and watch autopsies. They can get results quick. They can get, digital copies of the photographs. So they really don't need to travel as much. So things have changed and evolved, I think, due to technology. And, maybe one day they're going to have their own building. It's just no plan right at the moment.
Now, we also get fees from most of the law enforcement agencies outside of Pinellas County. We do most of the unidentified human remains in the state of Florida. And also, like the Hillsborough case, but like Tampa PD, Hillsborough County Sheriff, Pasco Sheriff, a lot of their major cases, they will have us do the work, especially the DNA work or the seized drug work. If it's a public safety issue, they need an answer quickly. So, and we're raising all those fees as well. We use, because the Foresight project actually gives us the cost per test, breaks it all down with personnel. It's an amazing project. And then we add 20% that goes to Pinellas County for every one of those analyses. And that's actually been becoming accidentally a source of income as well. And those fees are going up as well.
Great. Yeah, you guys have stayed pretty steady, too, in the number. I was looking at the number of folks that you have. You've stayed pretty steady in that as well.
Position this past year?
I had a doctor leave due to his spouse getting another job, and I just didn't fill him. I didn't replace him because we have fewer cases. And then she lost a toxicologist, not through any, she's just attrition, so we didn't fill her spot. That's probably the best way of doing it, I think. And we have total flexibility in the positions that we have, so you could make one, get rid of one as you need, and it just kind of blunts the, when you want to keep your budget low, it keeps you guys from, paying more.
And I put that out because you'll notice in their budget, so Dr. Thogmartin put in a 2% raise for his employees on that side. We don't have that built in on Rita's side, on the lab side. Whatever we decide with raises, we'll adjust their budget accordingly. Okay.
Yeah, I'll just follow your lead. What you guys do with the county employees, I'll do with ours.
Right. Yeah. Well, you run a tight ship and a really effective one, so we always appreciate what both of you do. And congrats on the award. That's awesome. 5 years running. I mean, that's just beautiful. Unbelievable. No other questions? We're good. Thank you. Appreciate it. All right. Human Services.
So once again, good morning, Mr. Chair and Commissioners. Tony Merrill's going to stay right next to me. She is the budget analyst for Human Services. And Karen Yacham and Carrie Vizendu are already at the table, so well done. Tony, the floor is yours.
Good morning again. Human Services, we'll go ahead on page 1 and look at their department's purpose. Going past the department purpose, you're going to see several tables. These tables show that human service budget is broken up into 4 funds. Those funds being the general fund, the drug abuse trust fund, the opiate abatement fund, and the local provider participation fund. The human services total budget for all 4 funds is $481.8 million, an increase largely driven by the growth of the hospital direct payment plan and the opiate abatement settlement. The department is budgeted for 100 FTEs, and that is unchanged. Next on page 2, you'll see the efficiencies and cost savings measures. Human Services achieved $261,000 in personnel savings through staffing efficiencies while maintaining service levels. The department recommends a $400,000 reduction to the pharmacy program budget due to improved vendor agreements and stronger internal management. There are also savings and efficiencies for fiscal '26 and fiscal '25, and you'll see those in your document and in the attachments. If you go down to page 3, we're going to look at your budget drivers, and that's going to start with the general fund. The general fund revenues are projected to decrease by $330,000 in fiscal '27. This is primarily due to the lower federal care grant capital funding. This is the capital grant for the new health vehicle. General fund expenditures are decreasing by 1.2 million to 65 million. Personnel costs increased by 261 due to staffing turnover. Operating expenses decreased by 330,000, primarily due to eliminating the Pinellas Community Empowerment Team funding. State mandated costs are increasing, while the juvenile detention cost remains the same in this document until we get those updates. State mandated programs account for 31% of the department's budget, and grants support 8.1% of expenditures. Capital outlay is decreasing by 440,000, and that is for the care grant vehicle costs, and those are split between fiscal '26 and fiscal '27. Grants and aids are decreasing by 159,000 due to the removal of a prior year non-recurring allocation. Now we'll look at the Drug Abuse Trust Fund. And this Drug Abuse Trust Fund supports local drug treatment and education programs, with resources increasing to 58,000. On page 4, we have the Opiate Abatement Settlement Fund. Fund revenues are projected to increase by 8 million due to the opioid settlement proceeds and investment earnings. Fund expenditures increased by 8 million to expand professional and contractual services. The Local Provider Participation Fund, this is a state administered, and this is a, what's the word? It's a mandate, but it's a pass-through. That's what I was saying. It's a pass-through with the fiscal '27 funding levels pending update, as we have not gotten that state information yet. Human Services did request one decision package, and this is a request for reoccurring funding for the Suncoast Center Sexual Assault Program to sustain 24/7 victim advocacy, forensic exams, and crisis response services. The county administrator is recommending this decision package. The decision package is for the 159,310, and that will bring the reoccurring amount up to $340,120. The department did not propose any changes to their user fees for fiscal '27. And at this time, I'm going to turn it over to Karen, who's going to speak more about the context and consideration, her accomplishments, work plans, and performance measures.
So first, I'm going to speak real briefly, Commissioners. As we talk about human services, and it's within your packet, but again, we have $20 million of unfunded state mandates, just right off the top, so when we're talking about budget challenges and we're talking about, reducing funding, this is what we face. We look at $14 million for a Medicaid match, $1.7 million for behavioral health. That doesn't even include the juvenile detention portion. That again, they're going to give us the number that we have to provide as the juvenile detention cost. That's a shared cost between the state and us. So $20 million or plus. Right here. I'm going to ask that, Karen gets into the whole sexual assault issue and the funding for that, because there's different pieces to that. And I know, Commissioner Scheer brought up the issue with hospitals. And so I want her to address that because it's a pertinent discussion. We had that last year. Commissioner Latvala brought that up. And, you know, we addressed that as a gap funding, but there's different funding pieces to that. So I do want to have more discussion. I'd like Karen to kind of outline that. But I didn't want to go this, we gloss over, you know, some of this, and this is an area where we just continuously get unfunded mandates. They up the amount each and every year, and then we just have to pay the bill. So.
Good morning, Commissioners. Karen Yatchum, Human Services Director, and with me I have Carrie Vizendu, our Business Services Director. So a little bit more detail about the sexual assault services and the decision package. So we recommended the 159,310 last year to close the gap for Suncoast Center. Since then, we've been meeting with them extensively. There still remains a gap of $176,000 to make their program whole. In doing a lot of the work, I've met extensively with the state credentialing body, which is the Florida Council Against Sexual Violence, and have learned that really this is a it's a hospital requirement. So hospitals are statutorily required to provide and or coordinate for the sexual assault exam services. And so in meeting with the CEO of Suncoast Center, I encouraged him to meet with every hospital that has an emergency room in our county to have the conversation about how the hospitals can contribute to this program, and they would no longer rely on county general fund. And so while he is doing that work, our proposal was to increase our allocation as a recurring amount, but have all of our funding, so the entire 340 move to the payer of last resort. So he would have to demonstrate that fundraising, grants, hospital contributions, all of that is applied to the program prior to utilizing any of the county funding.
And Commissioners, so first off, the 175, that's because they lost a grant.
Correct.
Correct? Mm-hmm. So, you know, it wasn't even the base funding. They lost a grant that was helping support their operation. Well, our policy is we don't supplant a state or federal, you know, grant cut. Because we have hundreds of millions of dollars out there, we just can't go down that path. But as we learn more about really it being a hospital responsibility, you know, we've treated our hospitals very well. You authorize the hospital direct payment program that generates hundreds of millions of dollars that the hospitals benefit from. That is not a mandate. We don't have to do that. But they're the recipients of those funds. We simply act as a pass-through and take a very small administrative fee to do that. So we've treated them very well. This is their responsibility. I think that we need to push back hard that they assume this cost, the full cost of this program. And that's something that we can talk about as part of our final recommendation, but I'll stop it.
All right, I'm going to go ahead and move on to the department context and considerations. So as Barry mentioned, mandates was one of the first areas that I wanted to touch on. And so the $20 million mandates, that includes a few other items in addition to the Medicaid mandate, the DJJ mandate, and the behavioral health mandate. We are required to fund child protection team assessments for children who are abused, abandoned, or neglected. We are also required to fund the Healthcare Responsibility Act. So if someone receives emergency care outside of our county, there is a mechanism for us to pay for them if they are considered indigent. We are also required for the Article 5 for legal aid and the guardian ad litem. So in total, that's $20 million, and it's 1/3 of the Human Services general allocation, which means 1/3 just comes off the top before we're able to execute on any prioritized local programs. The second area I'd like to touch on is a shift from general fund pressure onto the opioid settlement funds. And so we are proposing next week to shift all of the funds for Care About Me to the opioid settlement fund. This is the city and county allocation, so it's within this board's control. It does not go through the Opioid Abatement Funding Advisory Board. And so as we discussed at the most recent work session, our plan for the hybrid approach was really to lower the costs in total, but this would shift the planned $1.4 million off of the general fund onto the opioid settlement fund, making our budget really come in about 2.6 lower this year than what we had anticipated for general fund. The third area that I'd like to touch on is the Pinellas County Health Program. So last year, we discussed executing the evaluation of that program. That evaluation was completed. We are reviewing that report from the consultant, and our goal is to bring that to the board in August to make recommendations. As a reminder, the firm was looking at access to care for our indigent population in Pinellas County, effectiveness and operational efficiency of the services that are being provided, a review of the county's investment, financial performance of the program, and then funding opportunities for the future. And so in August, that firm will come and make those recommendations, and that may have significant impact on Human Services priorities and funding in the future years. Next, I'd like to talk about our accomplishments and work plan. And so, as you've heard already, the first accomplishment I'd like to really showcase is the reduction in overall overdose deaths and suicide deaths for our residents. And so in 2025, there were 266 drug-related deaths, and that's the lowest that we have experienced in Pinellas County in 10 years. And just for reference, in 2022, we lost 597 individuals. So that's a significant reduction. And much of that can be attributed to increased access to care, naloxone saturation, stronger federal controls, and increased law enforcement presence. We've also had a decrease in suicide deaths. And so in 2025, we closed the year with 174 deaths related to suicide, and that's the lowest that we have had since 2013. And much of that can be attributed to the work that has been done in community. So increased access to care through the coordinated access model, the JWB Children's Mental Health Initiative, county-wide training on mental health first aid, overall increased conversation about accessing that level of care, and just community increase to care throughout the community. Typically, I share more accomplishments about programs that we fund, but this year I really wanted to take a minute and talk about the programs that we deliver. So these are services that Human Services county staff deliver in the community, and they're not really contract related, so you don't get to hear about them at Board of County Commissioners meetings, but we truly are making an impact on Pinellas County residents. So I'd like to start off with our Veteran Services Division under the leadership of Michael Swanger. So this is a mighty team of 8 staff, and this past year, they brought in over $9 million of economic impact to our veterans and their families. And I'd just like to share a little story about one veteran that came and requested services from this team. So this past year, a Vietnam veteran facing severe cardiovascular complications caused by herbicide exposure turned to the Pinellas County Veteran Services Office for help during the most difficult times of his life. His health was declining, he was experiencing dementia, and added a tremendous strain to both him and his family. In March, our team submitted a supplemental review request that not only reaffirmed his cardiovascular issues as service-connected, but it also successfully established his dementia as secondary to those presumptive conditions. In June, the VA granted the appeal because of the work of our team, transforming his situation. His monthly compensation increased from $340 to $11,000 a month, reflecting the true severity of his disabilities. He also received a retroactive payment of $135,000 because of the work of our team. The outcome brought long overdue support, dignity, and relief to a veteran whose service and sacrifice had profoundly shaped his life. Wow. Yes. And it's $9 million that team generated for veterans in our community.
Congratulations.
Thank you.
That's amazing. That's great.
Another accomplishment I would like to share is our disability advocacy team. So this is a team of 7 staff under the leadership of Danielle Green. This team works with residents on compiling all of the documentation needed for Social Security disability applications. They meet with residents in their home, in community, they obtain all of their medical documentation, submit the application, and even attend the hearing with our residents. This past year, the team secured benefits for 35 residents who were all able to transition off of the Pinellas County Health Program onto Social Security disability. In addition, they were able to generate over $500,000 in Social Security disability income for residents and back payments. This is life-changing for residents who need ongoing medical care and Social Security disability income. Our consumer protection team also generates economic impact for our residents. And this past year, they generated $1.7 million in refunds and restitution for residents who had been harmed or victimized. And lastly, I could not close out without talking about the tremendous work we have done over the past year working with BTS on our ARPA-funded systems. And so we have implemented or implementing 3 new systems within our department. One is a contract lifecycle management system. The second is a new electronic health record. And the third is a new case management system that will really capture all of the work that we do as a department. This has been tremendous, and I would say at a minimum for the contract lifecycle system, it has transformed the way that we do business. It has transformed the way that we work with our vendors and has really moved us into a really efficient and effective process. For this next year, the following work plan items are going to be prioritized. And so we're going to be looking at a production of an annual performance report, so a roll-up of all of the services that we provide. We have lots of dashboards and reports for individual programs, but to date, we have never really done an annual report showcasing all of the investments and impact on residents throughout the department. We're also going to continue our work of expanding the Pinellas Matters program. Our goal remains to expand into 1 to 2 hospitals per year until we are in every hospital. We are currently at Bayfront and Northside Hospital and are continuing efforts to move into Largo Medical Center, Advent Hospital, and hopefully Baycare hospitals as well. We're also going to be working on implementing the health program evaluation recommendations after this board makes those policy decisions this year. We also want to engage our Pinellas County communications team to really showcase the impact. So some of the stories that I've shared with you today, being able to have a veteran or someone speak about the work that the team does, I really will help people understand what Pinellas County Human Services does for our residents. And lastly, we would like to develop an AI fraud prevention campaign. AI is moving very, very quickly, and there are some really bad actors that are targeting lots and lots of residents or systems. And so we're going to be developing a fraud awareness campaign to give our residents tools onto how to combat that work. And I just want to close out by thanking my team. I have a tremendous staff, 100 staff that show up each and every day to work with our residents and to provide the best care possible. Thank you.
Great report. Thank you so much.
Thank you.
Thank you all your folks as well for the work that they've done. Questions? Commissioner Flaibella.
I just had a comment, and I wanted to publicly thank Ms. Yacham for the help and assistance she's given me recently. As y'all know, because I may have complained about it once or twice, I serve on JWB, which is the most dysfunctional board and experience I have had in my life, because we have a few board members that should probably not be on there. But Karen has given me invaluable advice, not related to the CEO stuff that we're dealing with in the CEO search, but more along the lines of some of the providers that we work with and have issues with. And I just wanted to publicly thank her for that. So,
Thank you.
thank you.
Commissioner. Do you have any other questions? Okay.
Thank you.
Great work. That's all.
Thank you.
Appreciate it. All right. Animal Services.
So Commissioners, as Director Renner comes up to the table with Department Administrative Manager Kelly Kopla. We've got Shira Hegde here next to me. She is the budget analyst for Animal Services. You've seen her already this week, and she's got one more after this today. So with that, Shira, I'm going to turn the microphone over to you.
Thank you, Chris, and good morning, Commissioners. Thank you for having me. I'll be presenting the fiscal year 27 budget for Animal Services. Starting at the top of page 1, we have the department purpose. Next, we have the budget summary tables. Animal Services is supported by the General Fund and the Animal Welfare Trust Fund. Moving to efficiencies and cost savings in the middle of page 2. Focusing on FY27, a projected annual efficiency of $62,000 from expanding the online pet licensing portal and a $62,000 reduction in professional services costs driven by filling a second full-time veterinarian position and eliminating contracted relief veterinary services. We also have details on efficiencies and cost savings for FY26 and FY25. At the bottom of page 2, the FY27 general fund budget increases by $174,000 to $6.6 million. This is due to adding back $174,000 in personnel lapse savings from the FY26 budget, as the negative amount was originally budgeted for a vacant veterinarian position that has now been filled. FTE remains flat at 58. The Animal Welfare Trust Fund budget in the middle of page 3 increases by $22,000 to $240,000 in order to cover any potential overages in the general fund. The Animal Welfare Trust Fund is supported by revenues from contributions, which consists of donations to specifically benefit the animals. Personnel services stays flat at $25,000 and FTE remains flat at 0.5. Reserves decreases by $118,000 to $480,000. Moving to decision packages, the department does not have any decision packages for FY27. Next, we're on user fees. The department is requesting an increase in several user fees. All of the details are available on pages 3 and 4 of the document, as well as attachment 6 on page 17. Most notably, the dog and cat license fees are increasing. The 1-year license fee is increasing by $1 from $23 to $24. And the 3-year license fee is increasing by $2 from $46 to $48. And these incremental increases are to keep pace with market rates. Now we're in the middle of page 4, CIP, which will be presented later today. This concludes OMB's portion. I would like to now turn it over to Director Jennifer Renner. Thank you.
Good morning, Commissioners. With me today is Kelly Coppola, our Department Administrative Manager. Kelly's been a dedicated member of the team for 25 years now and an integral part of our budget development process, so I'm happy to have her here today with us. To put into context some of the challenges that we encounter at Animal Services when we're developing our budget, some of them are unique, some of them are not. But the most significant is absorbing the cost of the increase of goods and services, especially related to veterinary medical services. So we are seeing an increase in vaccines and diagnostic testing, anywhere from 10 to 40%. We're seeing an increase in our contract prices for essential items such as cat litter, pet food, and oxygen as high as 20%. And so that is difficult for our budget to absorb. And then when you compound that with the more unpredictable nature of the work that we do, not just the number of animals coming into the shelter, but the diversity of the species we might encounter. You might walk into our cat building and find a goat, some chickens, maybe a duck. There's a variety of snakes in our enforcement department right now, bearded dragons and exotic birds. So when you combine that unpredictability and helping with sick and injured wildlife in our law enforcement offices too, it does magnify that challenge of absorbing those costs. Moving on to our accomplishments, I wanted to start by, of course, once again thanking you, the commissioners, for assisting us with our Canines and Commissioners initiative. It's been very successful in driving more traffic to our website and increasing adoptions, and I'm happy that we continue to do that again this year, and it's something our staff certainly looks forward to seeing and helps with their morale as well. To highlight our enforcement department, we conducted more than 10,000 field visits this year. Our animal control officers are the boots on the ground out in the community, building trust and educating on responsible pet ownership. And so we're very thankful for the work that they do in the field for the shelter. We also expanded access to affordable veterinary care through our voucher program, and thank you to you, Chair Eggers, last year for increasing that amount and really emphasizing and prioritizing spay and neuter this year. It's been very successful. Last year, we helped nearly 1,000 pets receive free preventative care and spay and neuter through that voucher program. And it's something that we wouldn't be able to do without the help of our veterinary partners in the community as well. Understanding we've seen increases in veterinary costs, I know they have too, and their fees, necessarily need to increase. But through this program, we're able to help our pet families. And then finally, a thank you again to you for your support and guidance as we modernized and strengthened Chapter 14 right at the end of the year last year. That we couldn't have done it without you, and we appreciate your support there. And of course, I don't have any work plans right now, but our lobby roof is being replaced currently. During Hurricane Milton, the roof did have some damage. And so shout out to my staff right now who is working in a makeshift lobby and also outside as we're continuing to just really channel that flow of residents through our shelter and help to continue to adopt out the animals in our care. Thank you.
Thank you. Questions? Yeah,
I just have a comment. I just want to, kudos to you. I know we talked about just a second earlier, there were some issues with intake with some animals, and it was brought to your attention, and your staff have done a really good job at responding very quickly and coming up with a better solution. I think that's going to help lead to more and more adoptions and people finding their lost pets. So thank you to you and your staff for doing a good job. I appreciate it, and keep it up. Thanks.
Any other? Commissioner Flowers.
Just a question, and if you all have already shared the answer, I apologize. For like the bearded dragon and snakes and other things like that, do we partner with maybe Lowry Park Zoo or some other place if they can't be adopted? Perhaps they can become apartment dwellers with the zoo or something like that where,
We haven't, thankfully, risen to the level that we need to call in help and support from a zoo. I'm hopeful that that won't happen. At this point, we do have exotic rescue partners that assist with all of those animals. We generally have an outlet for just about anything.
Yeah, because, a goat.
We do have a farm in Pinellas Park.
We do.
And I don't know if you work with the farm in
Yes.
Patty's Farm.
Yes,
Lots of people
yes.
take the bearded dragons.
Oh, they do. They're very popular.
Yeah, my daughter has one.
If you have not been to Patty's Farm in
I have
Pinellas
not been
Park,
to Patty's Farm.
It is a beautiful, beautiful farm, and they put up a gorgeous barn for events, and the schools are now doing field trips there. It's what a great honor to really remember Patty Johnson.
I will make sure.
And
I
it's
go
definitely
visit.
worth a visit to the farm, and I know they would take that goat in a heartbeat, and the ducks and the chickens probably. And it's beautiful. What a great asset to have in our county.
I'll put that on my calendar to go visit. Thank you.
You're welcome. Thank you.
Great work. I know there is a lot going on in
Always.
your facility. Do you have a sense or feeling on that spay and neuter program? And by the way, the money we spent, that we allocated for that, was it enough to get through the year, or do we need to look at that number? How did that look on the spay and neuter program?
It has absolutely extended our ability to offer those vouchers. We just now paused that program. We're reaching the cap of the funding, but we still have quite a few vouchers out there that we're waiting for those to be submitted and reimbursed. And if they're not, then we will continue to offer more through the end of the year. We are offering up some wellness money for preventative care, but if we have emergencies coming in, we will absolutely divert that to spay and neuter as well.
And how does it's hard to put a number on it, I know, with your partners in the community and yourself, the pet increasing that are coming into the shelters, are we still on the rise? And it's a kind of a big problem, and we need to look at that even harder on the spay and neuter program, or are we being aggressive enough with it? That's a big deal.
I think we're making a much higher impact with not only the voucher program, but also TNVR. We are seeing a decrease of the trap neuter release program. We are seeing a decrease in, like, for instance, it's kitten season. So we're seeing a decrease in the amount of kittens coming in every year because we are reaching it is reaching a higher impact level. We are seeing an increase in shelter intakes, some owner surrenders, but we are also really creating a more robust safety net program. So we have a handout that we give anybody coming to our shelter that includes behavior resources, low-cost clinics. It's got everything, the voucher programs, also available to our veterans. And so when someone comes in and they want to surrender their pet, we're going to sit down and have a conversation and see what resources we might have out there in the community to help them. And that has diverted a significant amount of surrenders.
I would think that, there's a definite group of folks out there that would, because I always think about the older dogs or the older cats having a hard time finding a home. But there's a match out there.
There is.
Keep up that great work.
Excuse me, sorry, Chair Eggers. We have an excellent team of volunteers who pride themselves in the matchmaking process, and quite a few seniors that are looking for seniors.
Yeah.
So looking for a senior pet to just, live a comfortable life on their couch.
So as far as this budget coming to us to this year, you feel comfortable with the budget as far as addressing some of the issues that we've talked about? Spay and neutering is the thing that always is front and center to me, because if we're not doing that, if we're not getting ahead, or trying to get ahead, or less further behind, I guess, or we're losing the battle. So.
Yeah, I think what we did last year to increase that funding has made a huge impact. And I think as we move forward into next year, we do have flexibility in that allocation where we can move funds if we need to. So if we need more spay-neuter, we can do less with the preventative side with the vaccines. But I will say we're not doing one and giving up another. We are offering that preventative care package with the spay and neuter as well. So they are receiving everything when they're getting spayed, neutered, and vaccinated. So we're continuing to protect animal welfare, public health, and public safety.
And the changes to Chapter 14, making positive effects, even with our commercial friends that are,
Yes.
selling animals?
Yes, definitely. We are seeing positivity out in the community with our pet dealers and our hobby breeders as well, and certainly with our community when
Good.
dealing with public nuisances. We're seeing a overall positive effect.
I mean, it's been pretty quiet, so I always
It has
feel
been.
that's a good thing. So, great work.
Yeah, thank you.
Appreciate it. Commissioner Scheer.
Yeah, thank you, Chair. Jennifer, thank you for all that you do and your staff for taking care of our furry friends. Appreciate it very much. I did have some questions. You have 58 full-time employees, or do you have some part-time employees and they're all counted together? Do you have any part-time employees?
We have one part-time employee. That employee is funded through our Animal Welfare Trust Fund.
Do you have a program for veterinary students to come in and work part-time and then maybe go full-time, or?
We have a very robust internship program. We have veterinarians that are just graduating their veterinary school, and they come in and work with our veterinarians. Animal sheltering is a unique environment, so they learn high quality, high volume spay neuter with us. And we also have our veterinary technician program actually works inside the same building as our new medical building. And so we're able to mentor and coach those students as well. So the internship program is very popular.
Okay. Do you have a volunteer outreach for people who would like to come and volunteer for our animal shelter?
Yes. We have a dedicated community outreach team, and we had just last month, we had 118 volunteers on site who contributed over 2,400 hours. And then we also have foster families, over 100 foster families that take in the kittens, the medical cases. We have some very passionate volunteers that we're very proud of and thankful to.
Well, I'm glad to hear you're tapping into volunteers. Thank you very much.
Yes, you're welcome. Thank you.
All of the cats that are out there that, they're kind of, we try to trap them and neuter them, and they have colonies and that kind of thing. How do they get taken care of? Just a couple minutes about that.
We have two amazing nonprofit partners. We have more than two, but two of the larger nonprofit partners, Friends of Strays and Cat Trap Fever, who last year trapped, neutered, vaccinated, returned over 4,600 cats. And at that level, that's that high impact level that I mentioned, we are starting to see that community cat population stabilize. And as it stabilizes, eventually it will also decrease. And we're also keeping it healthier by vaccinating those cats, protecting them against rabies and future outbreaks. So our nonprofit partners are just working around the clock. They're out there trapping. I don't think they sleep. And I actually went to Hillsborough County to the Pet Resource Center to work with Cat Trap Fever on a Sunday last month. We brought in 142 cats. In a matter of 8 hours, were all spayed, neutered, and vaccinated. And it was with the help of 2 veterinarians and just this dedicated team, a well-oiled machine bringing those cats through. So I was really excited to see that, and I'd like to bring some of that to Pinellas County eventually through some grants that we're going to work on.
That's great. Awesome. Any other questions, comments? Okay, thank you.
Thank you.
Appreciate it. Business technology.
So, Mr. Chair, as Jeff and Brian come to the table, we're bringing John Ondrovic back next to me here. You've seen him a couple times over the last few days. John will be presenting first, and then he will turn the microphone over to Jeff at that point. So, John, the floor is yours.
Thank you. Good morning. BTS is fully supported by intergovernmental allocations and customer service revenues from BCC departments and non-BCC departments, and also customer IT services from various constitutionals and appointed authorities. The BTS is supported by 2 funds, mainly the Business Technology Services Fund, and it does receive funding through the American Rescue Plan Act, which is ARPA. Excluding transfers and reserves, the FY27 budget for the BTS is decreasing by $87,000 to $68.5 million. Personnel services is decreasing $939,000 to $26 million. This is due to 5 FTE being reduced in their budget to a number of 174 for the year. BTS does budget for contras, and it's a 1-to-1 contra with Safety Emergency Services for their staff time. Operating expenditures increases $260,000 to $32.5 million. They have experienced contracted services expenditures. This includes a $1.5 million increase, and this is a 6.4% inflationary increase to those contracts, and it's driven by market-wide escalation in software licensing, cloud services, cybersecurity tools, and telecommunication contracts. Their capital expenditures has increased $1.4 million to $10 million, and this is due to rebudgeting unspent funds and the second year appropriations for the ERP project. There's also a slight reduction in the realignment of resources within BTS CIP of $137,000. Under the ARPA fund, it is decreasing by decreasing $3.1 million, and this is due to ARPA projects being completed. At the bottom of page 3, we're going to talk about the decision packages. BTS has submitted 2 decision packages. The first one is Civil Serve. It's a $329,780 request. It's $152,600 for the implementation, one-time implementation, and then a recurring charge of $177,180. This one, the county administrator has not had a recommendation for the decision package at this time. Further discussion is needed. And what Civil Serve is a specialized public safety and civil process management software that was developed by Tyler Technologies. It's used by law enforcement agencies to manage the civil warrants, subpoenas, evictions, and the service of process. The second decision package is for the CAT system, County Application Tracking System. It is also in the BTS fund. It's $429,700. It's a one-time implementation of $334,007 with a first-year recurring of $95,000. And the CAT system supports the tracking and the resolution of Pinellas County residents, the concern and issues that present to the county commissioner and the county administration. This decision package has been recommended by the county administrator. The Business Technology Services does not have any user fees. And at this point, I'll turn it over to Jeff.
And before Jeff gets going, just commissioners on these, one of the things I think we really have to look at as we invest in technology is show me the efficiency. So if you're going to improve the process, let me see a vacancy be eliminated and give me an efficiency in the use of the technology. we always get the request, and then then without any return on that investment. So I'm going to look hard at those before I make a recommendation on any of these technology solutions. Okay.
Hi, good morning, and thank you for the time this morning. Jeff Rohrs, Chief Information Officer for Business Technology Services, and with me is Brian Zumwalt, Chief Technology Officer for Business Technology Services. Wanted to start off by just saying, you know, there's a lot of accomplishments that BTS makes every year, but I think one of the metrics that can encapsulate that is the percentage of our portfolio that is modernized. And I wanted to point out that today, through the last several years, we have been modernizing and systematically going through and upgrading our applications and investing in our software portfolio. And today we're about 80% modernized. And with the Workday project and some of the other projects that are in flight, we expect to be nearly 100% modernized in the next 2 years. And that puts us in a very healthy position where our applications are no longer 20, 30 years old. You know, when we looked at this, we really had a technical debt of many applications that were 20 years old plus. Now they're modern and they have features that meet the business needs, and hopefully create efficiencies, as the county administrator just mentioned. Second, I would like to mention that, you know, we've been experiencing about a 6% inflationary factor on our IT contracts year over year, and we've been absorbing that through either efficiencies or good contract negotiation, or even shifting products and services if needed to try to keep that down. But that represents a pretty big inflationary factor for BTS. And then in addition, every year we inherit new software. And this year is no different. In FY27, we're inheriting $1.3 million worth of new software. And that's unfunded software, so we have to figure out how to squeeze it into a flat budget target. And that creates a challenge. And then going forward, we expect that we won't be able to do that anymore. We'll need to make sure everything takes a pause and comes before this commission for consideration and funding so that we don't have to absorb those new software programs. So investments in new software and AI really need to be vetted and brought forward, you know, for consideration and appropriation. And then lastly, I would be remiss if I didn't mention that this budget submittal that is before you is not consistent with the official BTS board submittal approved by the BTS board. I would have to mention that this is really more of the county administrator's recommended budget for you all to consider. And with that, I would open it up to questions.
The BTS board recommended 5 additional positions that they reduced in order to meet their budgetary targets. And that will be the position that I recommend.
Sorry, can you repeat that?
So in order to meet their budgetary targets, they reduced 5 vacancies.
Okay,
and
5 vacancies.
In order to meet their budgetary targets, the BTS board voted to add those back in, but they don't have to balance the checkbook at the end of the day.
Okay.
So my recommendation is that we absorb that. They can handle it, and through the efficiencies that they've done an amazing job with that. But
Okay.
but they all have to be held to that same standard that we find efficiency. So I will be recommending without those 5 positions.
Okay, that's what, I just wanted to make sure I was clear on that.
Yeah.
And then the other question I have, because I'm not on BTS anymore, and I'm sorry, I don't know. I know there was a lot of work going into working through the different systems that have to talk to each other between the clerk's office, the judges, and all of that. So has all of that been, I know, because that was really causing some additional work from staff on the back end, and if you could have gotten that through, that would have given some additional efficiencies, not just for your department, but for theirs as well. Have you all been able to work through that, or you're close to, because it was a complicated system with about
Yes.
40 or so different programs.
Yes, absolutely. And we did complete the enterprise justice upgrade, which was, I think, what you're referencing, where we were upgrading the system and we needed to make sure that we interface. But the justice community is experiencing a lot of growth right now with a new Stack Web program in the public defender and state attorneys area. That needs to be interfaced and properly connected in so that we create those efficiencies. And then we're in the middle of implementing enterprise supervision for probation and supervision of releasees. And then as the county administrator mentioned, there is a decision package in here for civil service, which is an attempt to automate a lot of the manual processes around serving. And some key figures here. Currently today, we serve approximately 10,000 warrants a year, 6,300 injunction or risk protection orders, 3,700 writs, and 57,000 subpoenas a year. And all of that is really very manual today. And so the effort that you have in front of you as a decision package is to automate that process. And as the county administrator mentioned, we would hope that there's efficiencies in the sheriff and clerk areas, in the judicial areas, because now we're going to have an electronic process to eliminate that manual process.
So for the stack system, the state attorney did talk to us about that, and I fully agree with the automation of that, and then keeping that data digitally so that it can be recalled when needed, whether it's for court hearings, and then the length of time by which that data has to be stored. So my question is, and forgive me if it's somewhere in here, because this was a lot to read from when we got it to, these couple of days. Is that cost for that system being borne solely by the state attorney's office, or because there are several other constitutionals plus your office, is that cost being spread out across so it's shared and not?
For the Stack Web, it is actually funded out of the state attorney and public defender's office.
Okay.
However, the other half of that is the connection to our enterprise justice system, which we then need to make the modifications on, and we own that piece of it. Okay. So obviously, if you have two systems talking to each other, the Stack Web system, and they're handling that side, and we're handling the enterprise justice side.
Okay.
Commissioner, to your point, you provided the funding for both the public defender and the state's attorney for that stack system.
Yeah.
And so that does come out of the general fund. And then one additional thing is that as part of this budget, BTS is transferring one of their positions over to the courts for the coordination and implementation of all of that.
Okay. So that's why I was asking, how is that correlating so that it's not?
Yes.
Okay. Thank you very much. I appreciate it. And I do miss y'all.
Thank you, Commissioner.
Yes, Commissioner Noy.
Thank you, Chair. Thank you for the presentation. And one of the slides or parts, it said fiscal year 27, there could be no additional savings, I think it said in one of them. But I'm looking at like the travel and per diem. I mean, it's $230,000, though we only spent $12,000 in 25. So, I mean, I guess, could you provide some more context on why but we're budgeting $230,000 for travel and per diem, even though we only spent $12,000 in 25?
Yeah, we'd have to look into why it's showing that it's underspent, because we typically spend 100 or even 100+% of that every year. And that 250,000 in 2026, 230 is actually cut in half from the previous years, where we actually reduced that in half. And so we've actually already made about as much of a reduction as we would like there. I've always said that if you aren't investing in your IT staff and keeping them current, you're dying on the vine, and that's one area where I'd really be looking to protect as best as I can. But we've already cut it in half, and we do traditionally spend over 100%.
Yeah, I don't know. I mean, I'm just looking at the line item, and it says 23 to 25 average is $6,000, and the actual for 25 was only 12,000. So maybe
we'd have to look into the error there. It's definitely an error.
Okay, yeah, I mean,
definitely.
Yeah, I was about to say that's a big number to jump, but
Commissioner, we budget travel in one line, and then it breaks down into other places. So it might be travel, it might be a registration for a conference, but they all get budgeted up in the travel line. So we're going to have to roll some up so that you can see it.
Yeah, because I mean, if I have, some of my constituents saying we only spent $6,000 in '25, why are you spending $230,000?
Yeah.
I just want that clarification.
Yes, sir. We can do that.
Thank you, Commissioner Nowicki. Good question. Anything else? Anybody else? All good. Thank you.
Thank you very much.
So Commissioner Kevin McAndrew, Department Director of BDRS, and Andrew Nielsen, Deputy Director, are coming to the table. So welcome, gentlemen, and thank you. And Shira Hegde is back next to me here. She is the budget analyst for BDRS, Building and Development Review Services. And with that, Shira, I'm going to turn it over to you.
Thank you for having me back. Starting at the top of page 1, we have the department purpose. Next, we have the budget summary tables. BDRS is supported by the General Fund, the Building Services Fund, and the Construction License Board Fund. I'll discuss the numbers momentarily. Moving to the middle of page 2, efficiencies and cost savings. The department's FY26 operations remain focused on storm recovery while implementing structural efficiencies that will be fully realized in FY27. This includes a reduction of 5.0 FTE achieved through integrating the contractor licensing unit into BDRS and consolidating the customer operations permitting unit, both made possible by ongoing cross-training of personnel. We also have some details on efficiencies and cost savings for FY26 and FY25. Moving to the middle of page 3, budget drivers. Starting with the general fund, the FY27 general fund budget decreases by $310,000 to $6.9 million. Staffing decreases to 59.4 FTE, which is due to the division reorganization, which eliminates 2.5 FTE positions. Personnel services decrease by $287,000 to $6.1 million, and operating expenses decrease $23,000 to $793,000. On the top of page 4, the Building Services Fund. The department projects a $2.8 million decrease in permit revenue, primarily driven by House Bill 803, new state legislation that exempts certain non-structural single-family home work from permitting requirements, which is expected to reduce permit revenue while increasing unlicensed contractor activity and unpermitted work. The bill also expands private provider authority, limits municipal oversight, and will require updates to the county's ACELA permitting system to comply with the July 2027 deadline for uniform statewide permit applications. On the expenditure side, the FY27 budget for the Building Services Fund, excluding reserves, increases by $1.3 million to $10.1 million, and this is due to appropriating $1.6 million for third-party contractors supporting substantial damage, permitting compliance and enforcement for storm recovery damages. Staffing decreases by 0.5 FTE to 60.2 FTE, and this is due to division reorganization. Personnel services decrease by $114,000 to $6.1 million, and the operating expenditures increases by $1.4 million to $4.0 million, and again, this is due to substantial damage storm recovery expenses. The building fund maintains total reserves of $8.8 million, and this is primarily driven by $2.6 million in additional revenues in FY25. Moving to the Construction License Board Fund, the department projects a decrease in revenue of $366,000, and this is due to legislative changes that restricts its enforcement authority. On the expenditure side, the FY27 budget for the Construction License Board Fund, excluding reserves, decreased by $37,000 to $1.1 million. Staffing decreases to 5.5 FTE, which includes the elimination of 2.0 FTE positions due to division reorganization. Personnel services decreases by 48,000 to 522,000, and operating expenditures increase by 11,000 to 562,000, and this is due to the increase in full cost allocations. Moving to the top of page 5, decision packages. The department has submitted 2 decision packages. The first one we have is for third-party consulting services for $130,000 in the building fund. And the second one is for 3 code enforcement vehicles for $104,000 in the general fund. Both of these decision packages have been recommended by the county administrator. Moving to user fees. The department is proposing the third of a 3-year fee increase for development review services. All of the details are outlined in this document, as well as attachment 7, starting on page 33. This concludes OMB's portion. I'd like to now hand it over to Director Kevin McAndrew. Thank you.
Thank you, Sharon. Good morning. Morning, Mr. Chair, Commissioners. My first of 2 operational considerations will be highlighting building permitting demand, including a high-level trending update comparing 2026 to 2023 and 2024, and then speaking specifically to 2025, which was heavily influenced by storm recovery. For context purposes, on average, building services issues between 25,000 to 29,000 permits annually. Approximately 75% of those, or 20,000 plus of this total volume, is issued same day or next day through our express building permits process. The balance, which would be typically referred to as multi-trade permits and more complex, is split 80-20, 80% being residential, 20% commercial. Calendar year 23, 26,200 permits. Calendar year 24, 29,300. So we saw an 11.5% increase in volume between 23 and 24. When we look at where we are 5 months through 26 and projected out through the balance of this year, it computes to 29,000. So right on pace matching 2024. When I speak to 2025, we had a spike of over 4,500 permits, over 34,000 permits issued, almost exclusively due to storm recovery repair. For an 8-month period in 2025, our staff were issuing double the number of permits per month associated with residential storm recovery. This also in turn translated to a huge surge in next day inspection. We typically do 70 to 72 next day inspections per year. In 2025, we did over 91,000 inspections, and we have relied on third-party consultants to meet that demand and to maintain that level of service. To date, our team has issued over 5,800.
Kevin, you said 91,000 inspections in 25?
Yes.
And how much is in 24? What's the
Typically, we hover right around 70 to 72,000.
Okay.
So over a 25% increase.
Okay. Thank you. Sorry to interrupt. Go ahead.
Not a problem. We issued 5,800 storm recovery permits to date. What I want to tie into with all of this data is our staff leveraging the county's investment in Microsoft's Power BI platform. You've heard references to this. This has been now just an incredibly useful tool for our team to have access to live data and easily analyzing it, utilizing it to identify stress points, to look to see when we need third-party assistance, and to make improvements moving forward. And staying with the concept of leveraging technology, which has been a constant for BDRS, building upon this year after year, my second operational consideration is the role of artificial intelligence for BDRS. To what extent can operational efficiencies and customer service enhancements be realized, and what does the business model look like? What kind of return on investment can we expect to see integrating artificial intelligence. We will be piloting 2 AI phases through the full building permit cycle, partnering with our permitting platform, Acela. The timeframe on this, it kicks off the first phase next month through the balance of this calendar year into 2027. The first pilot will focus on the customer side of filing a building permit, and this is not to be underestimated. We get hundreds, if not thousands, of incomplete applications, wrong applications, that there's time spent on, frustration experienced by the customer. So we're confident that we're going to see a lot of enhancement from AI in assisting the customer, whether a homeowner, whether a contractor, in filing a building permit. The second phase of the AI will focus on automated plan review, and as to what degree can this support our plan reviewers in improving efficiency as well as potentially gaining capacity to handle a greater volume. I want to also express that the AI will go beyond just the permitting cycle. You just heard from BTS, and we're really excited about an initiative that BTS will be taking on, creating what we're going to refer to as an omni-channel AI agent. And to put a little context to this, we manage approximately 100,000 support phone calls a year in BDRS, as well as 5,000 or so website chats, which puts a significant strain. It equates to about 5 to 6 full-time FTEs that manage this customer support side within our division. So we're really, really enthusiastic about this. Is likely going to be a multi-phased AI agent rollout, but we think there's really significant benefit to be realized in that. I'm going to quickly touch upon 3 accomplishments for the department. The first is a public-facing building review dashboard that launched in December. This is on our webpage. I like to refer to it as a performance scorecard for the department, but I think equally important, it sets an expectation for our customers and predictability when filing a building permit. We have a 14-day KPI for first review for residential, 21-day for commercial. And you can track our performance on that dashboard. And this is one that, again, we'll be expanding that through other divisions, but we want that kind of transparency with our performance. We implemented 3 priority land development code updates last year: the noise ordinance, the tree ordinance, which was a very significant update, simplifying and introducing flexibility within that code. And we also moved forward a fireworks ordinance. The last accomplishment, just to briefly hit on, is acting on lessons learned from storm recovery. Starting at the top of that experience is having qualified resources in place on call following an event. So BDRS led and coordinated a procurement. The board approved this for a on-call professional services contract that's customizable, has the capacity and manpower to not only serve unincorporated county, but all 24 municipalities following an event. So this was a really important initiative that was moved forward. It was modeled after the debris management contract. And again, it has those resources in place now with any of the municipalities able to exercise that. Also, one of our biggest...
Just for clarification, the municipalities can jump onto that contract. It's a contract, though, between the municipality and that vendor.
Yes. Yes.
Well, just for clarification, they can't automatically, they're not automatically included. It's made available for them the way we bid that.
They're responsible for the administration and any costs associated with that. The other real stress point that occurred, and there was several of them, but probably at the top of that list also was trying to navigate the FEMA substantial damage estimator tool. And we've moved on from that. The county has entered into a contract with Forerunner. They are really the preeminent floodplain manager serving communities across the country. And they're actively right now building out that platform integrated with our Acela permitting platform. And so that will be in place. In fact, if necessary, which it won't be, it will be in place to deploy. Under work plan initiatives, I'm just going to quickly highlight a few. We will be back with the land development code before the end of the year. You can look to see additional flexibilities brought forward with regard to mobile home parks. Again, another area that we've learned a lot of lessons through recovery. I'm going to also touch upon two what I call quick wins. You know, it's great to roll out these multi-year mega work plan initiatives, but the quick wins can easily have just the same result. And two of them is promoting water conservation through the building permit process. Staff very quickly partnered and collaborated with Tampa Bay Water and SWIPMUD on the WaterWise and WaterStar programs. We've now deployed within our building permitting process. Every permit on intake receives an email back that includes links to these two programs, promotes water conservation, and provides information on the rebates. I'm proud to say that when we worked with both Tampa Bay Water and SWIPMUD, they said that no other municipality has taken this proactive approach. So we are taking the lead in looking to integrate this within our building permitting process. And another real simple one was realizing a savings of probably $25,000 to $30,000 a year. Our LPA and BOA board members have still been receiving paper application packets every month before hearings. Depending on applications, these can be hundreds of pages printed every single hearing. Within the next month or two, will be fully digital. They'll be working with tablets, as they should have been probably several years ago, but we'll have that in place and realize the savings of probably $25,000 a year. I'm going to hit two performance metrics. One, short-term rentals. We're approaching the first full year of the program. We're on track to hit 80% compliance for our registration. We have a goal of 85% in 27 and 90 in 28. With that said, with all of our new programs and initiatives, we're constantly monitoring them for potential refinement and improvement, and we are looking at improved enforcement processes within short-term rentals. There's been an uptick in complaints, so I'm confident that we'll be making some updates and refinements to improve our enforcement side. And on virtual inspections, we're going to have a significant launch next month, broadening where they can be used. We're projecting about 7,500 virtual inspections next year, as many as 20,000 in FY28, which is going to bring significant efficiencies to our department, but also tremendous convenience to the contractor and homeowners community. So I want to conclude by thanking this board and administration for your continued support in giving us the tools and resources to do our best effort with storm recovery. And I want to recognize staff for their sustained efforts and really embracing a whatever it takes mentality to, over the last 20 months, to be where we are and to also, over this past year, re-engage in continuous improvements. FY26 has been an important transitional year for the department. Shira mentioned that we've aggressively looked at cross-training to realize operational efficiencies, and we have, moving forward as part of this budget, realized a reduction of 5 FTEs in the department. We're going to continue to promote that approach across our departments and look forward to bringing that back with you next year. So thank you for the opportunity.
Thank you for that report. Any questions? I had a couple, Kevin. Permits and fees that we charge, too high, too low? Are we competitive? Are we doing what others are doing?
We are competitive, and in some cases, we're less, depending on if you're looking within DRS fees, but we're absolutely competitive.
again, kudos on the storm response. I mean, you learned our lesson a little bit from down south, but certainly, you know, it's still a tough process to go through to implement ourselves. And again, having heard, you know, a number of complaints, obviously, certainly in the mobile home community and in that whole area, and even in the normal process, by and large, you still get pretty good feedback. And on that front, do we have a way to get anonymous feedback from our contractors? Because let me tell you, the ones that I run into are never shy about sharing their feelings about any building department, much less our own. But, you know, maybe not so excited about putting their name out there publicly, because then you guys might hold it against them or something. Not that I believe you would, but is there a way to get anonymous feedback from these really high-level professionals?
There's a way to get feedback. It goes back probably 2 years ago. We did have door hanger surveys that inspectors were leaving behind, that we got feedback. It was more targeted towards their satisfaction of their interactions with our inspectors, but we can look at that type of deployment to get some more feedback.
Well, I mean, to some degree, there are going to be some really constructive thoughts from really good people. We have that group that we rely on to get professional feedback. But, you know, it's nice to get those folks that are out in the field every day. And some of them are going to complain no matter what, but a lot of them are really good. I'd like to capture that somehow. But anyway, thank you for...
Completely agree. Constructive feedback is welcome, and DCAG has continued to provide that to us, and we welcome that.
Overall, over the last 5 years, continued improvements. I mean, I remember we talking way back then, saying culture is a big deal, changing the culture of the organization and making it better, more, you know, again, I don't want to define what that means, but how do you see the department evolving generally?
Well, I use the term that I just stated, which is staff has, to me, clearly demonstrated a whatever it takes mentality with customer first approach. There's always more room for improvement, but there's been, I think, very steady progress made on that front.
Yeah, I know we're restricted by a lot of the codes that we have in place and all of that, but I always like the idea of like trying to find a solution to a problem. And that kind of attitude sometimes is hard to engender because of all the rules and regs that we have to follow. But I mean, that's really a big deal. Sometimes, especially if residents come in that are struggling with how to navigate the system. Contractors, even some contractors, you know, the more hand-holding, the better, you know. They have their jobs to do, and we should be working side-by-side kind of attitude as opposed to a contrary attitude. And I mean, it's subtle, but you can feel it. And so that kind of improvements I'm glad to see some of that, because I'm hearing it also. So.
Well, our project management team has been a big part of being able to assist. We don't differentiate whether it's a homeowner, a contractor, you know, a national developer. We welcome them from the time that they interact with us, from early assistance right through the building permit process, and see if that's the kind of assistance they're looking for. Yeah. So it's an awesome tool to be able to utilize.
Yeah, well, you guys, I mean, the amount of things you guys went through last year is just unbelievable. Probably should have had those animal service dogs at your place too, to give you guys some relief, because the amount of stuff that you've had to deal with and all of your staff, kudos is not enough, but both of you, I know, have had a lot going on there, so thank you. Anybody else? Okay, thank you, guys. Okay, I guess for our smallest department coming up, Public Works.
Yes, as Director Kelly Levy comes up and... Good.
Did you prepare them for that? You setting me up?
And we have Belinda Amundsen next to me. She is the budget analyst. You've seen her a couple of times this week. And
hi, welcome.
As soon as she is ready, I'll let you catch your breath, though. And Paul, good to see you as well, sir. So, all right. So, Belinda, the floor is yours.
Thank you, Chris, and good morning again, Commissioners. We'll be reviewing both the Public Works and the street lighting districts today. So we'll first run through the Public Works. We'll include all of your questions and comments and get through all of that. And then when we're done with that, we'll do a very brief review of the street lighting. So you have two documents. The first one is Public Works, and the second one is the street lighting districts. So today I will begin at the top of page 4 with efficiencies and cost-saving measures. In FY27, the department reduced their expenditures by $497,000 and completed projects that totaled $7.4 million. Reductions in FY26 totaled $902,000 with $1.9 million in completed projects. And FY25 reductions, which are at the top of page 5, they total $1.2 million with $619,000 in completed projects. And now we move to the budget drivers in the middle of page 5. Public Works is supported by several funds, and I need to point out that this first statement is incorrect. Excluding reserves, the department's budget actually decreases $7 million. So moving to the individual funds, general fund reserves decreased $702,000 to $3 million, and that's due to the completion of grant-funded activities. Overall expenditures for the general fund decreases $2.3 million to $19.9 million, and this is primarily due to personnel service decreases of $822,000 and operating expenditures decreases of $1.4 million, primarily due to the completion of the Vulnerability Assessment Phase 2 project. Moving to the County Transportation Trust Fund at the top of page 6, revenues decreased $1.1 million to $74.6. Total expenditures less reserves decreased $6.2 million to $76.2 million. And this is primarily due to capital outlay decreases of $5.5 million for the ATMS implementation project, which is expected to end in FY26. The fund's reserves increased $2.5 million to $31.4 million. Next is the Air Quality Tag Fee Fund in the middle of page 6. Revenues are increasing $85,000 to $1.3 million. Total expenditures minus reserves decrease $80,000 to $1.2 million. And this is primarily driven by a decrease of $79,000 for personnel services due to the addition of lapse savings. Reserves increased $425,000 to $601,000. Now we move to the Surface Water Utility Fund, which is at the top of page 7. Revenue increases $319,000 to $23.7 million from grant funding. Total expenditures less reserves increase $822,000 to $28.0 million. And this is primarily due to an increase of $923,000 in capital outlay for increases in the planned capital expenses for corrugated metal pipelining. Reserves increase $5.3 million to $13.2 million. And lastly, the Public Works portion of the Tree Bank Fund, which is in the middle of page 7, decreases a small amount to $25,000. The department has two decision packages, which are outlined at the bottom of page 7. The first is for operating expenses associated with 3 capital improvement projects, and the second is for median maintenance. At the top of page 8, we have some proposed increases to user fees. The department overall is proposing multi-year increases to several user fees, including mangrove trimming, water navigation permits, air quality, and certain DRS-related permits. Altogether, the proposed changes are expected to generate approximately $151,000 in additional revenue. CIP will be discussed in a little bit. And now we come to the department context and consideration towards the middle of page 8, and I will now pass the conversation over to Kelly.
Just real quick, sorry, before you get started, Kelly. Remind me what we did in 26. We started seeing these big numbers for reserves, what we did to fund those and from an expense standpoint, and then we're getting a $9 million increase there. Could you just, somebody speak to that, what that change in approach is in terms of
So,
Well, I know a lot of the increases in a lot of these funds is due to we obtained more revenues than expected and had fewer expenditures.
And more revenues being outside revenues or our own, I mean, like grants and that kind of thing?
some of both, partially grants, partially just the revenues came in better than we thought they were. So some of both, Commissioner.
So instead of essentially sweeping the account, at the end, we're keeping the funds there, parking them there? What's the?
Yeah.
Yes.
On the surface water utility fee, we did have some under execution, especially in 2025. So if you look at our capital expenditures and the surface water utility fund in fiscal year 25, it's very low. We had planned for $2.4 million in corrugated metal pipe replacement, as well as an additional $2 million in open channel maintenance, and we spent the first quarter of that fiscal year in storm response, and it also bled into the second quarter. So even our personnel services were not coming out of the surface water utility fee as they normally would have. They went to storm recovery and therefore were reimbursed through a different account. So those activities there, that under execution plus the storm storm work that offset our personnel services cost led to more funds going into that reserve. But it's still it needs to go towards maintenance that needs to be done and corrugated metal pipe replacement that we have to complete.
No, I understand. I'm just trying to figure out maybe a better way to look at that stuff on our information. I mean, I know it's technically reserves, but some of it's not really reserves. It's kind of capital projects that weren't accomplished that
Correct.
you're moving forward. Carry forwards.
It will be spent.
Yeah, so again, I mean, these are dramatic. I mean, we don't see them in 23, 24, 25, zeros, and then we see 36 million in 26, and 45 million in 27. So there's obviously a change in how we're dealing with those excess funds at the end of the year.
Well, and one of them was that amount of money that we put in from general fund lapse savings for the transportation. We put it in the transportation trust fund for the lighting program. What's it called, Kelly? I'm drawing a
You're
blank.
talking about the street lighting?
No, the 18 million that we put in.
Oh, sorry, ATMS.
Yeah, ATMS, thank you. So we put 18 million in, knowing we would spend 6 million of it a year. So you'll be seeing that spend down over time in the transportation.
That's showing up in the reserves,
Yes.
even though it's really spoken for in a capital project.
Yes, sir.
So I
And
don't look at it necessarily the reserve way. So
Correct.
it's been a little bit, I don't want to call it alarming, but it is something that, kind of jumps out. So I don't know how we can show it differently, but anyway.
Well, maybe you can just define it within the reserve because
Yeah.
it's really a planned capital project versus a reserve. And
understand
so
that.
maybe we can break that down better so it's better
It either goes to
articulated.
zero, right, then goes
Yeah.
into the reserves for the general fund, and then you have to redo the project and get it,
Let us take a look at defining that in the final budget recommendation.
So in the new capital budget, then, things that weren't used, will they be identified in the new capital budget, and that's how that part will be funded instead of the
Yes.
general fund for that particular year?
No, for those will stay, that's the reason they're staying within the capital fund. They'll be appropriated to do the metal piping and
Okay.
things
All
that
right.
she just said.
Yeah, and it's just the surface water utility fund and the transportation trust. Obviously, we don't have a departmental reserve in the general fund. It's
And since they're separate funds, that's how they keep a reserve. Otherwise, any of the other funds, it would be swept back into the
But all
general
these are
fund.
capital driven, so.
Chris, go ahead.
Commissioner, one other thing is you won't see reserves get spent in prior years. You don't buy a reserve, right? So you spend it in other areas,
Right.
but you budget reserves going forward. So you'll see zeros in those prior years. But in a budget, that's when we budget for a reserve.
I'm not sure I got that explanation, but.
Yeah, so you won't see actuals in the 3 years
Oh,
that are
okay,
prior.
okay.
There is no
I got you.
actual reserve, that's all.
So you set aside in 25 that much?
Well, we set aside an amount, but it would be spent in other lines, so you won't see it down in the
So
actual line.
eventually it'll zero out, is what you're
Yes, sir.
saying? Okay.
That's
So
correct.
it's kind of a moving, but yeah, so maybe a little more description in that talks about what those reserves, why we have that number in there, why there's an increase. I mean, I know you did speak to that a little bit, but, okay. All right, thanks. Kelly, sorry about that. Go ahead.
No, thank you. Thank you for the opportunity to present our department budget context for the upcoming fiscal year. And keeping in mind that the county's fiscal direction, we've prepared a budget that holds our expenditures, our work consistent across the board. And as we do so, I do feel it's important to outline some of the service level changes that will result as we move forward. So contractual services across our general fund, transportation trust fund, and surface water utility fund are continuing to increase beyond our ability to just absorb them without adjusting some of our service levels. So at this point, we're planning on reducing our right-of-way mowing from 16 cycles a year down to 15 cycles a year to account for the CPI adjustment that will occur in our right-of-way mowing contract. Keeping that funding that we have in the right-of-way mowing program consistent. Unfortunately, in our drawbridge maintenance, we saw a 20% cost increase with a recent contract that came in. So that we will have to meet that because maintaining our drawbridges and keeping them functional is a federal requirement. We have to be able to open them on demand as directed by the Coast Guard. So that is something we will pull from other areas to offset. Our resurfacing costs, when we started, looking back to 2024, we were at about $131,000 per lane mile. Today, currently, we are at about $150,000 per lane mile. So we're seeing, obviously, asphalt is very closely tied to the cost of oil. So as those prices fluctuate, we're seeing significant increases in that per lane mile cost, and that will ultimately impact the number of lane miles that we complete on an annual basis. And we are continuing to see those types of pressures emerging across our program areas, whether it be chemicals, lining those corrugated metal pipes, our pavement markings, signage, and other essential maintenance contracts that we do have. One of the other areas that we're really highly focused on is workforce competitiveness. And I think we've talked about this over the last few years. Some of our more technical positions like engineering have continued to be a challenge. But this year we've really had a challenge with filling labor positions. The labor market, they are offering a higher salaries than we are in those entry-level positions. So we're talking about the folks that repair our pipes, that fill our potholes, that mow our grass, that trim our trees. And we're really struggling in some of those areas to remain competitive and be able to bring folks into the department.
Kelly, on those front, do we have issues on the benefit side or just the salary side? And they tend to, becomes more important than?
It is, with younger employees, sometimes they see themselves as invincible and I don't need that insurance. So it really is that hourly rate that they're looking for. Just a little perspective, because I've heard you guys talk about the Alice report before, and I've spent some time digging into that report as well, because a lot of those people are in public works. And when I look at the Alice report, the most recent one, the poverty level for just a single person, no children, in Pinellas County is about $44,430. I have 100 employees who don't make that. So that goes into the challenge of being competitive in some of these areas.
I just saw the recent Alice report that was just completed by United Way. So the numbers are staggering. Even with a family of 4, you're estimated to have to make about $144,000 a year. But I want to ask or share, perhaps you already know, I know you all may be tapping into the Public Works Department for recruitment out of Pinellas Technical College, but the city of St. Petersburg also formed its own training department, which is hands-on training. They don't necessarily hire, and not because it's anything wrong with them, it's just whether or not they have the positions available. So if you didn't know about that, that may be a way also to tap into individuals in entry-level roles and positions. Dr. Tanja Williams was talking about expanding her technical trade programs through St. Petersburg College and partnering to kind of do that to make sure that they're providing the wraparound support services as well as the hands-on training. So you are right that that income level is very low, and when you factor in 30% of the income that's supposed to go towards housing, it is a challenge, especially when you have private firms that may be hired to do some work that we may contract with. They're getting paid more to work for them than we can pay them. So you may be aware of those programs, but just wanted to share those are some other avenues. They just graduated a class, snatch them up and see if that'll help some, some kind of way for recruitment.
Yeah, we did just participate with the Human Resources Department in their job fair a week ago, and like 500 people came in, and the Public Works desk was very busy. We had them applying on the spot, so we'll see what comes out of that. We have staff that are reaching out to those individuals who were very interested, and we continue to attend those job fairs and work with the Public Works Academy as well, but it has. This particular year, we have struggled with these labor positions.
And I'm gonna let you. The other thing I want to share too is, and I don't know where the county may stand on this, if they'd be interested. The city incorporated a component of that program for persons who may have some less than tender backgrounds, because those individuals were finding it difficult to get jobs, even manual labor jobs. So they created that program to help a number of people, but for those who have what I call those tender backgrounds, who are trying to become employed, but because of different departments or government rules and regulations when it comes to background checks, it was hindering them from being employed based on that. So that's a whole nother conversation for a whole nother time, but that's one of the reasons why they did that. And they're getting persons in, they're there, they're working hard, some have been promoted, So that's another. I'm sorry, sir. You were going to ask me a question.
No, just a question on the Alice report, which I should know the answer. On the single person, 44,000. Does that include an allocation for benefits, or is that just a salary?
No, that was just straight salary.
Straight salary.
Well, they have other components within that report, and I'll email it to you if you desire. But that was just straight looking at salary, what the median salary range was, and it compared. It gave the 5 highest cost of living communities to live in. We came in number 2.
Okay, well, I think, to your point, you said they don't seem to look at that aspect when they're looking for a job, but I was just curious if that was
it's strictly
reflected.
on salary, not anything
Because,
including
benefits. Those are significant dollars, but they may not see the value.
Yeah, I mean, when I tell you how close it is, I mean, we may be able to offer somebody $21 an hour, and they're taking a job over here for $23 an hour. So I'm not talking about this huge number. I'm talking about it, just a few dollars per hour makes the difference.
And you're not sure whether they're getting a comparable package completely?
No,
You don't
no.
know.
They're not, but that doesn't matter.
Yeah, okay. Did you have something, Barry?
Yeah, I mean, it's something we need to address, Commissioners, because I didn't plan on speaking to this, but Kelly brought it up. We're constantly trying to be cognizant of our tax rate, and we've reduced that for the past 5 years. But that's at the expense of, trying to address competing challenges. Our wages have fallen behind. There's no question, and we need to do better by our employees. We've seen fire departments give 20% increases under contracts. We've updated the sheriff, and we've done a lot with our current employees. We brought that wage up from $12.50 an hour in the last 6 years to $18. I think $18.23. What is it?
$18.36.
$19.36. $18.36. And so that's the entry level. And then we've created career ladders to where they get bumps based upon skill sets. So we've done a lot, but it hasn't kept pace. And so let's just take the reality is under FRS rules, we don't have a choice but to participate in that. It cost us, 13%, I believe. But you're not really worried about retirement if you can't pay the mortgage, or rent, in this county. And especially if you're younger, you're not really concerned about a Cadillac healthcare plan. So it is something we need to address. We have to see what happens in November, but I just put that as a place marker because it's something we have to put some serious effort into, following, that. And I do intend on setting aside money in the budget dependent upon the outcome. I mean, if we lose 184 million, well then, I think we have to relook at that. But if that doesn't pass, I think we've really got to address salaries for our employees.
Commissioner Scheer.
Yes, thank you, Chair. Kelly, of the 100 positions, the labor positions you were talking about, are any of them available for part-time employees that do not want a full benefits package? There are plenty of people that want to work part-time in the world. And you could actually even offer them more per hour without benefits, and it would be a big savings. Do we have a part-time program in your department at all?
We, in the past, we utilize contract labor through what's called PSP. It's a contract through the Human Resources Department. And we have used temps for work. They're typically not county employees, but we have used contract work. Again,
But they charge a fee, and that reduces the amount of money that goes to the actual employee.
Yeah.
So this is kind of what I've been asking about part-time employees every chance I get, is because I believe we have lots of opportunities in the county there are lots of people in this county that do not want to work full-time, that could be working part-time for us in different capacities like the labor. Maybe they just work 25 hours a week. We could pay them more per hour, and they don't need full benefits. Some of them might be even retired already, and they already have benefits packages. So we really need to, like I said at the beginning of the budget hearings, I think we should look at introducing some kind of program countywide that allows for part-time employees that don't require full-time benefits, because a lot of people don't need them. And we're not even looking at that labor pool that we could utilize. And, like I said, Home Depot does it, UPS does it, Staples has a plan. So you just pay them a little more, and then they don't need, they just don't want to work full-time. So anyway.
Well, it's meeting the market. That's what people are looking for. I don't know, again, what we're competing with. Are they, do they have to provide some level of benefits, these other organizations, or are they under a certain number of hours a week, like to your point of part-time job, maybe it's 30 hours, whatever that level is that defines part-time. But it does provide that opportunity to maybe bump your rates a little bit, especially for folks that don't,
So we do have policies regarding part-time employees, so that's all governed through the UPS, and so it defines when we pay benefits, when we don't, and all things like that. Different people have had different experiences with part-time employees. For instance, the sheriff's tried that out like at the courts. You got to rush in the morning, and by afternoon, not so much. You have to hire 2 or 3 HR people because of the constant turnover in the part-time people. And so he gave it up because it just wasn't effective by the time you train them, et cetera, and stuff. So it depends upon the nature of the work, and especially at like a fixed location versus field work where they go out. And so it's a great idea, and it's something we can pursue more, but people have had experiences with it in the past, and again, it depends upon the particular nature. Somewhere like parks is more effective, definitely at animal, services, as you heard. So, it's something we can pursue, but different types of jobs have had different experiences with it.
We really need reliability. We can't have somebody not showing up.
Well,
That's
I
been
don't
some
know
of
why
the,
you would automatically assume somebody that wanted part-time work would be unreliable.
No,
So-
we've had, and what I'm saying is even through PSP, we've had contracted part-time employees, and sometimes they just literally don't show up at all. And then we're calling PSP and saying, can you please let us know what's going on? And they decided not to come back.
Right,
Or
but that's with the
yeah.
labor company
Yeah.
that you call and ask for, send somebody. I've used a lot of that myself in construction. And, I need help for a week, and I'll call some of the people that they say they're going to never show up. But I'm talking more about a permanent part-time. Somebody's like, hey, yeah, I'd love to work for the county for the next 4 or 5 years part-time. I'm out of the military, I've got full benefits. What do I need those benefits for? I don't,
You know, military people.
Yeah, my son's just
No,
got out.
I was looking at Bill back there.
No,
but
there's lots
but
of people
it-
that
Commissioner,
would-
it's something we can look at. We can talk to our department heads about and let us report back to you,
Okay, great.
you know?
Some of the accomplishments for this year, of course, you are obviously aware of the completion of the beach renourishment project, as well as the agreement that was signed with the Corps to move us forward. This past year, we also did a lot of work out in our communities with our tree bank money, planting 250 street trees, distributing 1,000 trees to our community. And we just received a state award. We'll accept that next month for a project that we did in Lealman, specifically focused on that neighborhood and increasing the tree canopy there on private property. We have about over 200 lane miles of roads being resurfaced this year. We worked with the Parks Department to deliver their Rainieri and Dansville Community Parks projects and completed key safe routes to school sidewalk connections. And another really big one that I feel we need to highlight here is the over $50 million in grant funding that we brought in for resilience and transportation initiatives that really help help spread the penny out, gives us a little bit more robust transportation. You heard Tom talk about the ATMS update, and he brought up the FDOT iPad Pass and Attain grants that we received that is going to allow us to take that $18 million and even do more with it. And with that, we are also retiming signals across 12 corridors, which encompasses 129 signals, and installed 130 enhanced video analytics systems. For our work plan, as with some other departments, we did a strategic plan update this past year. After you completed your work and identified your priorities, we reevaluated our plan and shifted priorities. We made sure that we were aligned with your direction. And so some of our work plan priorities are really focused around the transportation system and addressing congestion and transportation safety and the ability to move people from place to place more efficiently. Again, the work on our unincorporated stormwater assets and addressing the deficient corrugated metal pipes by 2029. We still have a lot of work to do with the Army Corps. We still have easements to acquire, which means working with the residents on language that where we can get to yes. And we also plan on requesting design funding from the Corps for the next nourishment cycle, which is expected to start in 2030. As well as publishing a capital improvement project delivery dashboard. So with that, we remain committed to delivering our essential services as efficiently as we can and providing the board with clear visibility on our operations through our dashboards. Our focus does continue to be on long-term infrastructure resilience, public safety, protection and enhancement of our natural environment, and responsible stewardship of the county resources. Thank you.
Questions, comments? I just had a couple, Kelly. Just real quickly, can you, reconstruction costs for a lane mile versus just paving? What's the rough comparison? You have a, if you don't have it, don't, it's.
Actually, if I'm going to step up here and put something on the overhead.
It's a lot.
I'm sure somebody in the back is on
Somebody in the
it.
back, turn on the overhead, please. Well, if I don't get to go to lunch, you don't get to go to lunch.
2 more minutes till lunchtime.
Who did? Me?
Well, it wouldn't be the first time on that.
Okay, so this is same chart that I've had in other presentations. It's not new. I keep it handy as it comes up. So the current board approved level of service for our pavement is our arterial roads and our collector roads. The goal is a 60, which is good. In our neighborhood, our goal is a 50, which is fair and above. So you can see that 50, right about the 15-year mark, you can start, that curve starts to go down at that 50 pavement condition index. And above that, you know, we are very reasonable in our resurfacing costs, but as we trend down that curve, we start to see for every dollar we spend in prevention, we're up $6 to $10 to repair, restore, reconstruct. So it is always better to try and prevent damage to the base, to prevent damage to the overall structure of the asphalt surface than it is to try to fix it after it's in really poor condition.
And that to the point of, you know, we're going to talk about those 3 millages that we've used to catch up.
Correct.
And, you know, and how that, if we start to let it go, then there's a trade-off, right?
There's a huge trade. It is this shows you the cost effectiveness of maintaining your roads versus having to reconstruct a road. It is much more cost effective. But we always talk about pavement. I don't want us to lose, you know, because this is where you see the most, but bridges, you know, and culverts and the other parts of their infrastructure also go hand in hand. Those are less visible, but it's the same thing.
Yeah, obviously, all of it important. Well, first of all, kudos to you guys and you, Kelly, specifically on the beach renourishment. We've said that, but anytime there's a public meeting, it's good to maybe a few more people listen or hear about it. Thank you for all that work, and I know we still have work to do, but you and your team and everybody that past chairmen up here that have been involved and staff and all the groups. Secondly, I just wanted to say publicly, I think we have a really great relationship with FDOT. And I really appreciate their leadership from our district secretary all the way down to the person who, I think it's Julie Oskowski, who leads up Pinellas County. And her willingness to meet, to talk about specific projects. She meets monthly on projects that I complain about, and she gives me a lot of airtime. And I mean, it's really helpful because residents want to ask, and I don't know the answers. She's been wonderful, and I just really wanted to say publicly thank you for that, really. And what Tom Washburn and his team have cultivated over the years. Yeah. I mean, that's a professional relationship between them. And poor Tom, he hears from me all the time about different things, including huge bump on some of the work that they were doing on a road. And I called him and he said, I'll take care of it. And that afternoon they'd come out and they'd smoothed it off. And it just meant, it was about a drop about like this. I thought my whole car was going to fall apart. But anyway, little things to big things. They've been a great partner. And then, yeah, that's, I think I wanted to talk about the lane miles, which we just did. But appreciate all the work. Thank you so much.
And you get others, commissioners. We had I saw an email from a resident of a contractor work the other night, and Kelly responded late, you know, and said, we'll get on it. And by the next afternoon, the contractor was out making repairs and stuff. So yeah, there's a lot of issues that doesn't rise to your level. They do a great job of repairing those.
Agreed. Okay, thanks, Kelly. Thank you all.
You got the street lighting district real quick.
Oh, street lighting, yes, sorry.
Thank you, yes. So we'll move on to street lighting districts, and we're going to start with budget drivers, and we're going to stay in the middle of page 1 on the budget drivers. So for FY27, revenues are increasing $19,000 to $6 million. Excluding reserves, expenditures increase $27,000 to $1.6 million, and reserves decrease a small amount to $38,000. These budget numbers assume a 3% rise in Duke Energy utility rates, which OMB is evaluating across the entire budget. And this assumption does not result in any increase to customer assessments at this time. Thank you.
And kudos to downtown Palm Harbor businesses and residents. They all voted enough to assume the responsibility of the new lighting district should be coming online soon and kind of light up downtown Palm Harbor. I mean, maybe it's a different lighting district, but these are fully paid for at the ongoing rates by those businesses and owners. Thought it was important to mention in the spirit of lighting districts. Anything on your end?
Nope. That was the only thing I was going to mention, was that was the new street lighting district coming online with regard to this budget, was the downtown Palm Harbor, and I know that that work is done. So great news for the community.
Yeah, there are a lot of I mean, we go through the special districts all over our county that have voted themselves to pay more money to make sure that they get the services that they want, whether it's library, lighting, recreation, et cetera. So, thank you. All right, thank you all. Appreciate it.
Okay, Commissioners, you have, we have two final items. We have the capital budget, so we'll spend a little time on the capital budget, and you probably got hours talking about the Board of Commissioners budget.
How many hours?
Whatever questions you have, but I did have them set up lunch, so it's up to you if you want to.
Yeah, we'll start back at 12:30.
Okay.
Then we'll hit those two and then call it a week.
Okay, great, thank you.
Tom, you coming for a minute?
Barry, lead the way.
All right. So first, on behalf of all of the departments, agencies, and constitutionals, I want to thank the commission for giving us the time these past 4 days. It's a lot of time, but they've spent months trying to develop a budget that reflects the budget guidance you gave back in March. It's also important, I think, for you to see firsthand the effort that they've taken to try to minimize their costs, to try to find efficiencies, and to try to bring you a budget that provides good service at the lowest possible cost to our residents. And you can see that in real time, department by department, agency by agency, where they come in under, and absorb cost increases. So that didn't occur without a significant amount of effort. And I really want to thank all the agencies and departments, but I also want to thank, and most importantly, our budget staff and our OMB staff. They've met with them for months upon months, trying to find that, trying to push that, trying to challenge, the department to do something different or come in and try something, or looking at fees. You're seeing the outcome of many months of work. And so I just wanted to take time to thank them, thank Chris and the entire team for their efforts that brought us here for us to have this type of discussion today.
Yeah, well, thanks for saying that, Barry, and I think on behalf of the entire commission, we feel the same way, about your folks and how hard they work to bring and to deliver what we're getting to see this week. And I think it's important to hear accomplishments, but also that new plan going forward. I think the last 3 or 4 years, we've tried to go down that path of being, very careful with our dollars and residents' dollars. And now this was an extra step this year to kind of make sure that we're kind of getting in line with, the pressures of the day, so to speak. But good job, and to staff and the budget staff, thank you.
Okay, so we got two final issues. We've got the capital budget and then the commissioner's budget. But I wanted to start off, Commissioner Nowicki brought up something to you, and he may have to leave before we get to the commissioner's budget. So I wanted to have an opportunity for him to mention that, and that's the $1,000 that he had mentioned to you before for the youth group about a scholarship. And so I'll leave it for your discussion.
Yeah, I just, briefly brought up to Barry and Chris, I'm happy to, reduce, my office budget by $1,000, for a scholarship for YAC, and, let, JP or the students and Barry or Chris, work out, some scholarship requirements and guidelines on how it would be given. But I just, wanted to bring it in front of the board to see if there's any interest, if, we wanted to, subtract like $100 and some odd from everybody's office budget. If not, I'm willing to reduce mine by $1,000 to cover it, or.
What was the thought behind the 1,000?
Well, I think the recruitment and involvement of the YAC was down, and so to go to schools and other youth organizations to say, hey, join YAC, there'd be an opportunity to get that, $1,000 scholarship to go towards your books or a college semester, would be a good way to bump up recruitment.
Yeah. Okay, I was just curious if 1,000.
And a lot of them drop off.
Yeah.
Yeah. It's a good way to keep them from dropping off.
Commissioner Flowers.
Thank you. I think it's a good idea. I'm happy to pitch in 1,000 from my office budget. As the incoming president for the Florida League of Cities, I had at my discretion $2,500 to do a $2,500 scholarship. The first thing I asked staff with FAC was, could I include the YAC members when it comes to the application? Because it was certain criteria, and they had to fill out an application and whatnot. And legal did look it over. And I couldn't even include the constitutional officers' children of employees. And so that was the key thing. They had to be children of employees of the county. So I wanted to help.
You're talking about it, the fact.
Yes.
Okay.
Mm-hmm. So I wanted to do that for fact, because they put in a lot of time and work and effort. But I couldn't do it that way. But that amount was $2,500. Books now can run you $250 to $300 per book. And then if you have a class that has books, plus your lab fees, plus the pointer and all that stuff, UCF, it's far more than that. So I support the idea, anything that we can do to try to help our youth, and they do put in a lot of time, work, and effort when they could be somewhere else, maybe working a part-time job or something like that, but they come in to us. By the way, I did select somebody. It's an employee of, and y'all will find out, they're gonna come to Orlando, and I'm presenting them their check there, the young man, his check there. So I support it. I think it's a good idea. Not all kids get scholarships. Not all kids' families can afford to pay. And this could mean the difference between somebody going to school and not being able to go to school. I don't know if legal needs to look at it more to see if it's an allowable expense and all that other good stuff. And if something's wrong legitimately there, I would even support if we had if we partnered with some companies or entities or whatever that would collaborate with us on presenting a scholarship for one of the YAC members. If you want to look at criteria, I'm happy to share with you the application that FAC uses because it has very specific criteria in it. And certainly just as a guidepost, if we decide to do this, happy to share that now.
In the spirit of like crawling before we run kind of thing, we could step it up a little bit over the years, maybe do 5,000 as a total, and we could see how that, or 1,000 as a total, whatever the number is, kind of, well, she was talking about 1,000 from her office, and so it's like, let's just kind of, figure that out. But Commissioner, you had a comment.
Thank you, Mr. Chair, and the chairman's in for 1,000 as well. One thing that I have noticed is not in the last couple of years of being involved in YAC is not only do the numbers decrease as the year goes on, is that also not a lot of seniors are involved. And I think this will be a way to get more seniors involved in YAC, so I am supportive. However whatever the scholarship number is, and my office will contribute as well. Is the thinking for the IFAS staff to select the scholarship recipient or the commissioner who oversees YAC to
I mean,
choose
I
the
was thinking
scholarship?
more of the staff, and maybe in tangent with like the kids voting amongst themselves of like who's most worthy, or, because I think they're pretty like honest from, you've obviously been on it for a couple years, but my short time, it seemed like the kids were pretty honest and holding each other accountable of like, hey, you're not showing up. And so, I think it would be a good way for them to continue to have that real world experience of making decisions. So no, my thought process was not having a commissioner or this body, to determine who would get that award. It would be more staff and the students was kind of my thought process. But
Did you like your experience on YAC?
Yeah, I had a great time with your leadership.
So that means you're not going anywhere, I guess.
And if the board's in favor, I mean, I'm happy to, reach out to a couple, like community, like stakeholders, to see if they're willing to sponsor it, but I just didn't want to operate without, this board's approval or, without talking to Barry and staff first. So if, this board's okay, I'm happy to, like we raised money for the flagpole, I raised money for a flagpole to go in. And so, if this board, I'm happy to do either. So just wanted to run it all by you first.
Yeah.
And if we're doing a sizable dollar amount, maybe, let's say 5,000, maybe you do 2 for 2,500, and maybe the one of the criteria could be a certain field that is affiliated or associated with government work, like engineering or stormwater. Kelly gone. Stormwater engineering, or a field where we're looking for forensic science or something like that. Just throwing some stuff out.
And that gets to the evaluation.
Uh-huh.
Like, we've heard two different things. One, how they performed during the class, but the other was doing an application that may be based on,
and they can write an essay.
needing a little help.
Yeah, they can write an essay. It's all kind of ways you can do it. Yeah, but it's all kind of ways you could do it. But if we get, if persons really agree and we get a nice sum maybe give 2 to graduating persons. And anyway, I'm sorry.
Well, I'm
Yeah.
happy to
Yeah.
contribute $714.28 to the $5,000.
How much would that be?
$714.28 to get us to $5,000.
Whatever it turns out to be, I'm into.
Yeah, I think we're heading toward maybe 5,000 for the group.
Right.
But let's get more details in terms of how we're going to
we don't-
evaluate and that kind of thing.
We don't have to decide it today. I mean, but if you want, I can work with Commissioner Nowicki on kind of formulating this and bring it back for the August, time.
And I do think that if we decide it, we should use it as part of the advertising in schools to get more kids signed up.
Oh, we gonna have 30, 40, 50 now.
Yeah.
Which is good, but.
Okay. Great. Well, then,
thanks.
we've got that. We'll work on
Thank
that,
you,
bring it
Commissioner
back
Nowicki. Good idea.
when we have our budget.
All right.
All right, with that, then we'll move on to our capital budget and turn it over to Drew.
Thank you, Commissioners. My name is Andrew Brown. I am your capital budget manager. With me today, I have the CIP team, or at least 2 of the 3 CIP analysts. I have Kristen Pittman and James Lewis. At home on maternity leave is Gabriela Gonzalez, but the 3 of them are the folks that put together the packet before you today. We also have department staff in the audience. Major thanks to them. It's a huge collaborative effort to put all this together and summarize it all for you, so thanks to them. So today we're going to talk about the capital improvement program, specifically governmental capital improvement projects. So what that is non-enterprise. The enterprise departments have been presented to you, so airport, utilities, and solid waste are excluded. What it does include is the tourist development tax for your beach nourishment projects, and we'll touch on each of these categories. It includes your ATMS projects funded by the 9-cent local option fuel tax. It includes countywide investments, so that penny that's set aside off the top of the penny. And then finally, we have county penny funded projects that we'll talk about. So just a reminder, it's a 6-year plan. We update it annually. The first year, FY27, must be balanced per state statute. The outer years are just a plan. And again, we'll focus on penny projects in a couple slides. First, we have coastal management. There is 2 decision packages, the aggregate of which is a decrease of $25 million. Kelly previously mentioned to you that Sankey has completed. And so it's going to return $25 million to fund balance for coastal management projects, which is good because there's 5 new projects that we want to add to the plan. You can see them listed there. The majority of them are scheduled to begin in FY30, and they do reflect the uses agreement, so it does anticipate a cost share, those amounts. And I'm happy to report that the program is balanced. ATMS program is also balanced. There's no new projects, no new decision packages. Next, we have our countywide investments, AKA the penny set-asides. So per interlocal agreement, starting with penny 4, off the top, 11.3% is taken before anyone gets a piece of their pie. 8.3% is set aside for economic development capital projects and housing, and a previous board resolution determined to split that equally between those 2 categories. And then 3% is set aside for jail and courts facilities. We do have 3 new jail and court facility projects that we're recommending. You can see them there on the screen. That comes out of the 3%. That is not impacting county penny, and there is enough balance to fund those. And then finally, I'll just say that the countywide investment programs are balanced.
What's the annual amount? At $2 million a year, that's what we're getting in off the penny. What's the amount that we would have allocated?
For which category?
For the jail and courts.
68 million.
68, okay.
Yeah, 68 million for jail.
Total.
For the 10-year.
Yeah, for the 10 years.
So 6.8 million per year.
6.8 million. So we're going over a little bit for this year.
Those are multi-year amounts. That's your total project cost.
This is the 6-year.
Yeah.
Okay,
Yeah.
excuse me. Go ahead.
And again, those programs are balanced. So that takes us to county penny. So just a reminder for the folks watching at home, county penny, or penny for Pinellas, is a 1% local option infrastructure sales surtax. It's been in effect since 1990, most recently renewed in 2017 with 83% of the vote for a decade, January 1st, 2020 through December 31st, 2029. That is why we call it penny 4. It is the 4th decade. And then once the countywide investments are taken off the top, you can see the distributions on the screen. County gets 51.75%, city gets 48.25%, and that's based on population. So County Penny, there are decision packages included in your backup. The aggregate of the increases is $36.6 million. That includes grant funding, though. That is not a net impact to Penny. That includes grant funding. And then the aggregate of the decreases is $30.4 million. Increases and decreases outlined above are incorporated into the County Penny forecast that I'm about to show you. We do have a couple new project requests, most of which are not impacting County Penny. So the first is a public safety campus HVAC new supply well. Back in 2024, this board allocated about $8 million to facility improvements. Those projects have completed under budget, and there's about $1 million in lapse that we can reappropriate to this facility project. And so that's our recommendation. There's also a 500-ton air-cooled chiller addition for $1.2 million at the public safety campus. There's actually a general government facilities program. We're going to ask them to take it from that penny that's already in the plan instead of asking for new penny. Let's eat up the penny that's in the plan for facilities before we come asking for new penny. So again, no net impact to penny. Fred Howard Park Causeway concrete slope improvements, same story. There is a park program project for park improvements. We're going to eat up that penny that's already outlined in the plan. And then finally, we have a new project request that we're actually going to take back out and revisit. Fire response water tanker vehicles. This presentation was put together back in May. Some things have unfolded, and we just want another opportunity to look at it.
And commissioners, on that particular one, these are old water tankers that they support all the different fire agencies, one in north, one in south. We're going to relook at the EMS fund and the fund balance that's in there. It's really what its support is in the EMS area. So we'll look at that. We'll bring it back as part of our final budget.
And just a reminder, these new project requests are incorporated into the County Penny forecast. So just a reminder, revenue projections have been updated, expenditures have been updated, includes new projects. The capital projects fund is balanced through FY30, but that's not the whole story. Let's take a look at County Penny specifically. So when we look at that program, County Penny revenues versus County Penny expenditures, last year we reported that we were 44 million upside down, or 4%. 212.031 business rental sales tax was repealed effective October 1st, 2025. Estimated impact is $50 million to our revenue through the end of the decade. We're reporting today that we are upside down $94 million. So we've remained relatively flat, but we did take an impact to our revenues, and you can see it there on the screen. Just a couple considerations included in the plan. We still do have Dunedin Causeway programmed in at $50 million in County Penny. Penny revenue estimates are a little conservative, and also we also program FY27 in at 95%. County projects and interlocal agreements are trending below budget, so hopefully things will come in under budget, and interlocal agreements will complete with some lapse savings. And then finally, $320 million in Penny 4 construction is planned for FY29 through 32, not awarded, so we do have time to take a look and reprioritize our plan. Finally, back in 2017, we advertised to the public, or it educated the public, what we thought that the penny categories would be spent on. So you can see the 2017 column, 45% on roads, bridges, trails. You can see the percentages there. 2026, this is what we anticipate to spend on those categories now. We're remaining true to the original 2017 categories and their allocations, with two exceptions: roads, bridges, and trails, and community vitality.
Second, I'm sorry, just going back to the balancing comment you made. If we have what, technically 4 years, we're 95 million shy on the remaining 4 years?
Correct.
Yeah.
Yeah. So, I mean, it's about, say, 20-some million per year. What are we estimating right now on it that we're getting in the county piece? Are we getting still in that 90 to 100?
So FY25 was actually 111 million.
Oh, okay.
FY26 estimated to be 102 million because of the repeal of that law.
Okay. So it's significant what we're short is what I'm getting at. It's about 25% of what we're got.
The impact will be 5% of the total penny for the decade, $50 million. Your total penny for the decade, the revenue is anticipated to be 1.04 billion.
I'm talking about what's left.
Yeah.
Yeah, is that what's left? Because it's about 2 billion overall for the 10 years. So what's left is about what?
Yeah, you anticipate an additional $400 million through the rest of the decade, and so that 50% would be, I don't know. Yeah,
So we're just trying to get a scope of what that shortfall is.
Yeah.
That's
Commissioner,
what I was trying to get, so.
If we can, let's zero in on a project you've been heavily involved in is just deciding what we're doing with Dunedin Causeway. I mean, that right there is a major piece that we always knew was out there. We always said with the 44 million upside down, we were really balanced because we knew in our heart of hearts we're never going to get the money to be able to do Dunedin Causeway. It won't compete on state or federal grant cycles just because of the volume. So we're working with the Florida Department of Transportation on options. When we solve that, that potentially has a major impact on how much we're out of balance. And so now we're talking about making up the difference. Let's just say that it's 50 million. We're talking about making up the difference in increased revenue because they're conservative on the revenue estimates and or projects at the end. Okay.
And that 50, that would be, in that case, left would be about 12 a year.
Yeah,
12
something
or
like
13,
that.
yeah.
And what you would do is you would just take, and you've done this at each penny, you'd take projects at the end and you'd reprioritize them over to be the first projects in the next penny.
All right. Thank you. Go ahead.
And so again, I just want to reemphasize that we are still spending on these various categories and honoring the 2017 list. We're spending more on roads and bridges and trails because this board has decided to allocate lapse funding in previous years for community vitality. So it's not that you're not spending on community vitality. It's just it's being funded via penny and other sources. So finally, FY27 is balanced, required per state statute. Capital Projects Fund is balanced through FY30. The various programs are balanced through FY30, with the exception of County Penny, which is balanced through FY29. And that's my presentation.
So where's the workforce housing? Is that under community vitality?
One more time, I apologize.
Workforce housing.
The affordable housing is actually not under community vitality. It's off the top.
It's above the line.
Above the line, the countywide investments right here.
Oh, okay.
Yeah, this is all our money that we're getting.
Okay.
Yeah.
Community vitality would include a lot of vertical construction. So South County Service Center, the acquisition of that would have been categorized as community vitality.
Okay. Any questions?
And I don't know if this has anything to do with it. Are we still looking at selling the office on First and Fifth and
501?
St. Pete?
501? Yes.
Okay.
At the right time.
At the right time, okay, because that was gonna be my question, like, are we looking at that right now? And would that be a potential revenue-generated resource that we could bring back into?
We're going to try to package that with all of our bond issuance, new campus,
Okay.
all of that, and look at the funding sources and the timing of those. That one requires us to work with elections and make sure they have
Right.
a new home and everything's seamless to where it doesn't impact their election
Because
cycles.
that is the hub for
Correct.
early voting. Okay. I was just thinking, like, do we have money from there?
Yeah, we need to put all these in a nice package, for you to where, we can have those types of discussions and financial impacts.
But I will also caution us, that's one-time money, so it doesn't recur, doesn't help balance the budget really, but, okay.
But it does help maybe pay towards.
One-time things, yes.
It will absolutely help us with our new center. Yeah, and we just got to get, and that's part of the reason, like with the lease with St. Pete wanted some space. I don't even know if they took the space, but we had it contingent upon, listen, this is a gap, right? Okay, because at some point. But we've been working with supervisor of elections, making sure all the different pieces are aligned and we're all in agreement.
Any other questions? Are you guys done?
Yep.
All right. Thank you.
All right.
Okay.
So commissioners, as you know, I am your budget analyst. I don't delegate that to anybody else in my staff. I do every year, though, have one analyst, one member of the office help me because, in all candor, I am the weakest link with our technology in the office. So Rufus Barfield, here next to me, has helped me put your budget together. And we've been working on it for a while now. So thank you, Rufus. Appreciate it. Hey, you know, every budget deserves attention.
Dollars, so.
Yeah. So I know they're going to get it up on the screen here in a minute, but I'm going to go ahead and get going. You can see that you, Commissioner, leading the way in having a budget smaller in 27 than it was in 26. Now, there's a reason for that. When we put the 26 budget together, we thought that the salaries that the state requires and mandates were going to go up faster and higher than they actually did. We also thought that your FRS contributions for elected officials were going to go up faster and higher than they did. So we're reaping the benefit of that this year, and we've got a smaller budget for you this year. So the budget also includes a retirement payout that we know of somebody retiring. We do this commonly in other departments as well. When we know of a position retiring, we'll set that money aside. If it happens when we don't know, when it happens mid-year, that's when sometimes we just have to absorb that in those department budgets. But we know one's coming for you, and it's built in. Number of positions remains flat, 14, 7 and 7, 7 elected, 7 aides. And like all departments, this budget does not have salaries built in, neither for the elected officials, salary increases, excuse me. It does have salaries in there. But it does not have the salary increases for either elected nor non-elected in your offices. Also, just like last year, each office budget is remaining flat right now at $11,440 per office budget. We will talk about at some point how much we notch that back to cover the scholarship we just talked about. And with one exception, that is District 7, we had an additional $3,500 built into District 5 for the last 2 years. We have it in next year's budget as well for travel associated with Florida Association of Counties. So
I'm requesting that that amount be removed because as the president for the Florida Association of Counties, FAC covers quite a few of my costs. And so the nominal things that I would be paying for, I would be able to cover out of what everyone gets. So I am very thankful for Commissioner Latvala even bringing it up about 2 years ago to increase, and that did allow me to go to a lot of activities and functions as the second VP, first VP, and president-elect. So thank you so much for that. I really appreciate it. But I don't think it would be right for me to have FAC, you know, paying for those costs, and then I have that extra in the budget.
Yes, ma'am.
So it's my contribution back to, it's small, but it's my contribution back.
Yes, ma'am. I still expect you to go to Tallahassee, so I don't have to go. So.
Yes, if I have to ride my grandson's scooter, you know, so if you see me on the interstate like this, you know, just wave and make sure I'm okay. But I do really appreciate you guys supporting me in that because it was a lot going on and it allowed me to be where I needed to be when I needed to be there. It wasn't anything over and above board, you guys that are listening in. It was just to get me where I needed to go. So I do appreciate that, but I think it wouldn't be fair to keep that.
Well, appreciate, all the work you did, but also taking that back because you.
Like I said, they will wait until my term to do all this stuff. You know, I may need about $3,500 in aspirin. Just kidding, but so that'll be coming out, sir.
Right. Aspirin is in the office budget, so you're good. So, one last thing for everybody. In the very last page, you can see some actual user fees that are tagged to the Board of County Commissioners, and that's because they're common to all of the departments that report to you all. They are the dishonored check fee, how we treat credit card charges, and charges for public records requests. So rather than have those in each and in every department, we put them in y'all's department honestly, my department keeps track of it for you, but that's what that is, and I just wanted to make sure I got a chance to educate you on that. And with that, Commissioners, I'll turn it back over to the chair.
No capital computer stuff this year, right?
Correct. None in the office this year.
Just checking. Yes, Commissioner Flowers.
So when persons make public records requests, we have the ability to charge them for the staff time as well as per copy.
Yes, ma'am.
So why are we including that as an expense? I'm just asking.
This is to give all of the departments the authority to charge those. So it's not a budget, it's a user fee. If we didn't put it somewhere, we wouldn't be allowed to charge it. So this is where we put it so that it relates to every department that answers through the Board of County Commissioners.
Okay. Any other questions? Anything from you as we end the week?
That's all, Commissioners. Again, from staff standpoint, we really appreciate the time. I hope it was helpful and informative, and it'll help us when we get to our budgets here in August.
Like hearing from staff. It's good. So we'll be back Tuesday for a commission meeting in the morning.
Yep.
And then Wednesday and Thursday.
We do not need those days.
Oh,
You have those back. Those were backup days.
Oh.
Those were backup days. If you got in and you had a lot of questions that we needed to follow up on, we had those days to be able to come back and discuss those items. Absent that, this is it. Wednesday and Thursday, we're giving them back to you unless you want to come and meet. Staff's happy to come in if you want, but
1 o'clock on a Friday, we're finished. That's good.
Joel, I don't think is going to make it.
Commissioner Flowers?
I just want to say this for the good of the public that may be looking. I don't know if, and I didn't do it for this reason, I just thought about it, but just to share with the public, we, commissioners, we actually go through and read all of this information so that we are prepared for presentations, and then we're prepared to have the actual dialogue that we have to go ahead and finalize a budget that has to be ready to go and in place by October 1. And so sometimes I think residents think that we don't, we aren't doing this. It is a lot of work that goes into it from staff, and then once we get it, it's a lot of backup and reading that we have to do so we can try to know as much as possible about the budget and ask good, solid questions about the budget and make decisions based off of that. So I just wanted to share because I had someone ask me and I said, hey, I like to look at it online, but I also like to write notes. I said, and I have it printed out if you want to see how much is entailed here. So thankful to staff. Thank you for getting it to us. I know it's still a work in progress because we don't know what's going to happen as it relates to the referendum on the ballot, but thank you all for the work that you did. I know it's kind of hard with some ifs and ands and buts, but it's just as hard for us because the community is asking us about the if and ands and buts. So just want to say thank you all for that.
Thank you. Maybe just take 10 seconds or so to just let the public know what the next dates are as far as budget goes. The only meeting we have in July, we set the maximum millage.
So July the 21st? Yeah, so July 21st, we'll ask you to set the maximum millages, which will be the current tax rate. And then we will present a balanced budget to you on August the 11th. So between now and then, we've got to go to the basement and print up $21 million plus. So we'll work with our departments to close that gap. And that's how, and then I'll be talking with you individually, but that's the date that we'll present the budget recommendation.
That's the first commission meeting in August.
That's the first commission meeting in August. Okay. And I'll be presenting the budget at that time. You'll then have the remainder of August and September for your deliberation, changes, modifications, alternatives, and then pass a budget in September.
And so residents responding to that proposed budget that's coming, they can come to the commission meeting, the second commission meeting in August.
They're welcome to come and hear the recommendation. It'll be posted, it'll be online.
I understand.
And it'll be the 11th. We also have a commission meeting on August the 25th. And then our 2 public hearings on the budget will occur on, the 10th?
10th and 24th.
The 24th.
Yes.
And they certainly can come there, but by that time, it seems almost like you're almost getting
Correct.
fait accompli. It's not like it's going to be major changes, but if they want some input, they can start to get, when will that, a copy of that proposed budget be available? It's
The
coming-
11th.
You'll have it posted before the 11th.
We were going to post it on the 11th because we want them to hear it first.
Okay.
But we can do that.
Okay.
Okay.
So the first
So,
opportunity they'll get is really the 5th, the 25th.
20, yes, 20,
So there's a workshop on August 20th and then a commission meeting on August 25th.
25th, you're correct.
Okay, so we have a workshop on the 20th. Okay, we can talk about that, whether we want to allow any public comments on the budget only for that meeting. Maybe the 25th. Oh, 25th for sure. Okay.
25th for sure. Workshop the Thursday before, and then obviously,
Okay. So
And
in-
again, commissioners, we have these as dates, if as we get into this and look at this, if you want to do something different, additional dates, it's always hard with your schedules, but these are the dates we work from. We can always do something different.
All right, so the 11th will be presented. The 20th will have a workshop.
Yep.
The 25th will have a commission meeting. The
Yes.
commission meeting, they can certainly take their time to, and,
Yes.
and we'll talk about that 20th, opening up comments if we want to see any comments or listen to any comments from residents on the budget only.
You can do that.
Okay, we'll talk about that maybe at the commission meeting on the 11th. Okay?
All right.
Yes, sir.
Just one thing, Chair. I was going to, looking at the calendar, I was going to suggest, that we might look at November and maybe pencil in a strategic planning day. Should the tax amendments pass?
Oh, yeah.
Because I think January, February, we need to get a head start on that one if it passes. Just an idea.
Yeah, we mu- Yes. Okay.
Yeah. That will be, some beginning
We
of
would
some
have to, yeah.
adjustments. Yeah. Okay, all right. We're adjourned.
Thank
Everybody
you.
have a good
Thank
weekend.
you. Oh, yes. Yes, salad.